Does it make sense to put a battery in your mouth that leaks mercury? Maybe not. Mercury vapor comes off of filling 24/7, depending on the heat, the stimulation, if there's friction. The vapor goes into the tooth also. By definition, it's coming out everywhere. The bone is intimate with the gums, and it just starts to leak into that area. So it's like a toxic shock syndrome.
It's wild to hear that the FDA even acknowledges that this is a problematic substance to put in people's mouths, but they're still being taught in dental schools. A good chunk of them are still offering amalgam fillings.
If you read the books about fluoride, it goes into the uranium. Does fluoride make hydroxyapatite stronger? The answer might be maybe not, but putting it in the water is a big problem. Well, my story is like, I want to be a dentist since I was 8, but I was always questioning everything. I mean, I lived on a lake when I was younger, and I used to dissect animals, which sounds weird, but they would wash up on the shore, often. And I always like this will be a public confession of me when I first had a BB gun, which is sad, but a lot of boys have done it, I guess maybe, because we are hunters, I guess, deep down. So I excuse myself now because I made an estuary, a beautiful place, a garden for the birds and the bees now. But I mean, I think my dad may have been aware, but I did dissect a couple of the animals that I did take off the planet, but I feel a little guilt from that. But then I think, is it experiential? Did it teach me something that I didn't know? But anyway, I learned about blood flow there.
Yeah.
So I wanted to be a dentist since we were 8 years old, but I kept, asking questions. And every time I got into a subject matter, I dove deep.
So from early on, you wanted to be a dentist?
Yeah, 8.
That's cool.
So, but I was didn't know what it entailed, obviously, except I had a few fillings. And I can talk about all these things really quickly so people know. I could talk about sugar because I had that. Then I had my first mercury filling at 6 or something. And then, whatever electricity shined on my brain that day, it made me want to be a dentist by 8, right? So, but, I could talk about all the things. Now I know about the nutritional aspects of what was going on. I mean, we grew up with Captain Crunch. I mean, I graduated. I've been a dentist for 33 years.
That's amazing.
So
I'm 33 years old.
Okay. Really? Okay.
Yes.
Well, all my teachers, it doesn't matter what age they are.
Yeah.
So I would say you're my teacher.
Well, you're about to be my teacher. So,
but I guess what I would say is I honor my teachers through all of it.
Yeah.
But I'm skeptical of what they're teaching me now more than I ever was, because I think even you're sort of naive at 20. Your brain's not completely synced up and your frontal lobe's not completely connected by 20.
Right.
So I'm in dental school learning about anatomy and even back then I didn't know what restorative materials were. And when you had the dental material list, you find out mercury's in there and they tell you it's okay. So now it's common sense when I'm skeptical about things does it make sense to put a battery in your mouth that leaks mercury?
Right.
Maybe not, and so you can, when you're in the institution, my son Matthew's in medical school right now, and I pray for him to discern the difference between what might be the powers that be or the status quo, and then try to regroup your education or, refine your education into what's the cause of things. So that's kind of what we could talk about today.
Yeah, I would love to.
The cause of disease. And I have a metaphor which comes off harder when I do a talk, but a long format, if you want to just think about your cake, this is your cake. Your head is your cake, and we're going to bake the cake, right? So a patient comes into my office with their head baked a certain way. So it could have nothing wrong except for some little bit of tartar, but it could also have mercury, bunch of different metals, a root canal, infection. So we look for hidden infections, toxicities and pathogens, and we try to figure out how we can reverse that and unbake the cake. So if we unbake the cake, we have to identify all those things. And then we have some magical tools now, like 3D and stuff. And so now I look at someone's head in 3 sections. You have the coronal, you have the sagittal. So I look at 3-dimensional things, which before when I started in dental school, they didn't even have the technology of a cone beam for dentistry. Yeah, and so now we look deeper. So a 2D X-ray might not show as much, and now we can see a lot more.
With a 3D one?
Yeah, and pretty soon there's going to be an ultrasound, which I have put a deposit on machine. Hopefully will be FDA approved at some point. There's always those things that you have to go through. Yeah. But there's no sonogram for this bone. You can do sonogram, ultrasounds on all kinds of long bones, but there's there's nothing for the mandible or the maxilla in terms of the skull. So it's very finicky how things have to be. You have soft tissue, hard tissue, and you have multiple layers of soft tissue. So when you have a sensor out here, you have to kind of figure all that out. But that'll elucidate like whether we have these deep chronic infections and what they look like in the bone. And the bone is like hard trabecular bone with something going on inside it. Mm-hmm. So, or hard cortical bone with trabecular bone that's kind of been changed. So that marrow space, I call it a bone box. These bone boxes have these weird things happening, and it's our plan. We just have to have a strategic plan to remove all the things in the cake that are not good. Also, brings into the whole idea of what's the ingredients for the cake, right, to rebuild the bone. So we could talk about Weston Price stuff. Yeah. And I love that. He's like my mentor, even though he's long gone.
Let's start with the sort of beginning for you with what you learned and what the overwhelming majority, if not all, dentists learn in their formal training and education on dentistry.
Okay, that's a great way to start.
Let's start there first, and let's dissect like what you are taught that you have now learned is incorrect. Obviously, we're going to get into fluoride. We've already mentioned briefly, but I'd like to get into the details on amalgam fillings, root canals, and some of these other things. But I'd just love to hear what you were taught versus.
Well, first of all, we probably could do a part 2 of this. I would love to, maybe with a physician or somebody who knows like the dentistry really well. But traditional dentistry is still taught today. In fact, they even teach amalgam still, which is kind of sad
because the FDA acknowledges that this is problematic now, right?
Yeah.
And there's still, despite that, it's insight into how long it might take, even if the regulatory and authoritative bodies acknowledge the harmful effects of something for other institutions to catch on. I'll just give like a small anecdotal example. When I badly sprained my ankle about a year ago now to where I could not put any weight on it, almost fully ruptured my ATF ligament. And I was taught from a young age as an athlete that you do rest, ice, compress, elevate. We had an acronym called RICE. The guy who came up with RICE retracted it in 2015. And still to this day, the overwhelming majority of physical therapists, a lot of athletic trainers, hospitals for sure, urgent cares for sure, are still pushing RICE as if that is the appropriate guideline on how to tackle all this stuff. So the point that I'm getting at is it's wild to hear that the FDA even acknowledges that this is a problematic substance to put in people's mouths, but they're still being taught in dental schools. And then also most dentist offices, or a good chunk of them, are still offering amalgam fillings.
Yeah, well, I mean, I could go back to the amalgam issue, but in the general sense of why things are taught, I mean, we're way behind in things we know, like in the clinical lab, when we do controlled trials. And I think that the institutions have a long time to, like, it's like turning around a oil tanker sometimes. But I don't know why. I mean, maybe if it's something horrible, like lobotomies, for example. There was a group of doctors that said that was probably okay. And I don't know what turns that to being like that's not a good idea or solution. So they knew back then, with the amalgam situation. But yeah, like for what you were saying, like blood flow and things with sprain, we know more about muscle and how to deal with it. I don't know. It gets kind of caught in the cogs of higher education in some ways. And then all the protocols, they're influenced by we know now who influences who. I mean, I don't really want to bad talk or talk about people or organizations, but it's the fourth turning and people are really dying because of inadequate dissemination of the truth of information. So
obfuscation of the truth.
Yeah. Like my friend is fighting the Mercury issue at different levels, Anita, and she's looking at the UN, and they actually were going to ban it. And then now they kicked it down the road another 9 years. But everybody knows about it. Everybody knows mercury's toxic. They just, I don't know what it is, if it's money.
Well, it's also, I think a lot of you have to put yourself in the shoes of the general public. I think most people don't make the connection between amalgam and mercury. They think it's two completely
Well,
separate.
we'll go back to your original question because I don't want to, I want to say what I could say about traditional dentistry. I love my school. I went to the University of Maryland. And they know not what they're doing now. Like they're caught and they're captured in a way too, I guess. That would be what I would say. But they are influenced monetarily too. And that's the way that, accreditation and all these things. So, but I guess what you come out of dental school with is a lot of technical precision on treating a lot of different problems. So I like to say that the necessity is the mother of invention, which I think Plato maybe said or something. I mean, he's quoted as saying it, or he's written as saying it. But what that means is we have a problem and we have to figure out how to fix it. So breaking teeth. I mean, I like to talk about Weston Price because he was like the first guy saying, why are my patients having heart attacks? Why, so that he knew
why
the systemic
palates not as formed.
Yeah, there's so many things he saw like anatomically, but he saw like physical deterioration and he saw it. And then he went around the world with his wife and like, I really admire like the research he did.
If you frequently tune into the Way Forward podcast, don't skip this one. This is personal. If you've ever felt a shift from something that you've heard on this podcast, if it's helped you to see things more clearly, if it's helped you to break down a limiting belief system, if it's helped you just to generally question, or if it's helped you to feel less alone, then I'm asking you from my heart to help us keep going. We're not backed by corporate sponsors, venture capital money, or big donors, and that has been a deliberate choice. And we've said no to a lot of ad deals that weren't aligned because we don't want our mission to be shaped by products, brands, and agendas that we don't actually believe in. There are a few trusted brands and products that do support us, and we're incredibly grateful for that. But the reality is, this is primarily sustained by our listeners and viewers. Right now, this podcast has roughly 140,000 video and audio downloads a month, and it's continuing to grow. And only a small fraction of that actually help contribute financially. That's not a guilt trip, it's just the reality. We haven't said this directly enough, so here it is. If you'd like this podcast to continue, please help support us by becoming a member of thewayforward.com. If even a small fraction of listeners and viewers chose to support, we'd be able to easily sustain this. A membership at thewayforward.com is $99 annually, which amounts to about $8 a month. Think of it like a couple organic kombuchas at your local health food store, or maybe a fancy latte every month. And also think of it like this. In addition to ensuring that we can continue, you're actively supporting yourself in the process. TheWayForward.com is a private membership platform that allows you to instantly connect with aligned people, practitioners, farms, schools, restaurants, and more in your local area. And if the platform isn't for you, we've added a donation option as well. You'll find both of those in the show notes. If you've received something from the show, please consider giving back by becoming a member so we can continue to reach people, not just as a podcast, but as a movement for something good, true, and beautiful. Thank you so much for tuning in, and thank you for walking this path with us. I don't think I've actually had anyone share on this podcast in depth, as relatively speaking, within the context of a show. Obviously, there's multiple books on Weston A. Price's work, but could you just share a little bit about exactly what he noticed in his practice?
Well, I love him so much. I used to have round glasses and a bow tie. Really? So that's what he wore. Okay. When I lectured at Sally's, I think I had that when I at her farm.
I like that look.
That's good. Yeah, it's good. It looks good. You look like, a little dated, but no, I used to wear a Marcus Welby sort of like shirt in dental school. So I would cover my tie. By the time I graduated, we didn't wear ties and it was scrubs. But, I was always cognizant of like the bacteria and the bugs and stuff. So anyway, you ran across his book. It seems like people run across his book and they're like, whoa, it's this thick and it's all his research. But, he's a father of biological dentistry as far as I'm concerned. He really studied nutrition and he analyzed the food, actually, the intake, and so you can start to see like whatever the information he gleaned from like all the populations of people around the world. He saw a few things that were similar. He was actually even saying like his buddy was a obstetrician. He was saying the birth canal is getting smaller too, dude.
No way.
Yeah. So stuff like that. It's kind of a fun fact, at a party, you can tell people.
Yeah.
But the palate didn't, and he said there wouldn't be like people like Caruso and these singers that are like amazing because of the airway. So that stuff he figured out. He was the ADA president for 10 years or so.
Weston A. Price was?
Yeah.
I didn't know that.
Yeah. Wow. It might be even longer. I remember reading about his, like he was going to have all his findings. I could just see it right now. Like he was going to present all his findings and it was like not very well attended compared to whatever might have been on the other side of the aisle, or whatever someone else was presenting. So like, this is my job, with this community, you guys can keep talking about this stuff and tell other people when they're injured in some way. But I'm going back to dental school again. Where was I? Weston Price. So he talked about all the building blocks. Like that's what I wanted to talk about. Like he found out that they had been eating fats and fermented foods. And so you kind of look into that now and you say, what does that mean? It was making plant chemicals more digestible in some way, and maybe downplaying some of that. Anyway,
so correct me if I'm wrong on this.
So he basically introduced the idea of working with the body, and he also systemic disease through nutrition, but also the modern foods, which he called the foods of modern commerce, which was like sugar, canned food. Like they were putting crap in the food back then. Like actually at the turn of the century, there was like copper sulfate and all the stuff we're talking about now with food. I mean, they had dyes back then too. They had been experimenting with coal tar dyes back then. And there was a physician that was trying to change all that and label that food wasn't labeled. So anyway, he taught me to be skeptical about what I see. And so now when I see a cardiac patient, I'm always thinking, what's going on there? Or if I see a diabetic patient, we're going to look for like root canals fail 5 or 50% of the time fast or twice as fast, in individuals they don't have to be controlled necessarily or uncontrolled necessarily diabetics. They can just be like fluctuating higher and lower on the sugar.
So on the Weston A. Price thing, just real quick, just so I'm clear.
Yeah. So keep asking me.
Yeah, you're fine.
I'm going down lanes.
No, you're good. I want to make sure I'm clear on it. So he
published in 1939, but he traveled for like a number of years before that, then put all this stuff together.
Yeah. So essentially what happened was he started noticing people come into his dental practice that had these issues that were not prevalent in societies previously. Right?
Yeah.
And then so it
ramped up then.
So then he started traveling to areas across the world that did not have as many dental nor health issues. And what he found was a lot of common things amongst those societies that, because of let's say the introduction of a lot of our quote unquote modern food in
they were isolated
countries.
Populations.
They're isolated populations specifically, where they had these fully formed palates. They didn't have any of the modern diseases that were becoming more prevalent at that time in Western countries.
They were healthy, not cold. Like kids were running around the Swiss Alps with with just a t-shirt.
So he's really the guy that, like you said, was the father of biological dentistry, in the sense that he was one of the first people to make the connection between dentistry and nutrition and lifestyle, to the degree, because I know a lot of modern dentists do in some ways make that connection, but he was really saying that no, they are inextricably linked, and they are directly related to where if you do not have adequate nutrition and you're eating some of these things, you will get tooth decay. If you live this certain lifestyle, you will get dental issues.
Well, he saw it in the children and the adults. Like, so he was in Cleveland and he saw the kids that were like in schools, they were disorderly. What do we call it? Kids that are in trouble, whatever.
Behavior
issues with children. And he would have them run out in the sun, vitamin D, and oil pull with like fermented cod liver oil and butter. So, like he was giving him the A, E, K2, D3, K2. K2 is actually the Weston Price kind of identified that, right? And they called it price factor, factor X. And now Chris Masterjohn, who's you probably met him, right?
I've not met Chris Masterjohn.
He's a PhD in nutrition. I mean, he's very insightful into like how our A, E, K2 work together. And need so many building blocks. But what Weston Price was noticing was the shift in the food. So we were already eating 100 pounds of sugar per person per year, like in 39.
Wow,
like
I can't even imagine what that is.
Yeah,
now.
so now it's like 200.
Oh my gosh.
Yeah,
man.
so it's a killer. But anyway, he kind of like, if you think about the different locations, he always found commonality, even though like, I love the idea of the Gaelics, which is a Gaelic island. They ate fish and some sea stuff, that's all they had. And they had oats like that grew maybe like a little bit of oats. So they had like maybe that.
Supplemental oats.
They would give a pregnant woman a whole entire fish, and they knew about that. And so he identified like where things were, nose to tail, lips to tail or whatever on a fish, whatever you want to call it.
Lips to back fin.
Yeah, I was joking about explaining everything from, the whole alimentary canal, the lips to the other end.
Yeah.
That's the biological dentistry moment where you asked me, the original question was about what are they teaching? They're teaching us to be mechanics really with the mouth, but in a really beautiful way. And also, it's not like they don't know there's a connection between oral health and systemic health. It's not like they don't teach that. They're failing in like recognizing that there's potential hidden infections that don't hurt, hidden infections producing other systemic effects. I think that they're failing to, and I don't know, maybe they're talking about more with the, there's a lot of orthopedics and the ortho fails with the bugs from the mouth. So cardiac, same. So I don't know. I just feel like not throwing them under the bus other than they have to be more proactive in like when they learn new things. It's ridiculous that we're still even like it should be assault if you went into someone's office and they put, it should be.
If you put mercury inside their mouth.
So.
Well, with understanding of how dangerous it is.
Coming out of dental school, I was excited to do what I do, and I never knew, I was kind of ignorant. And I learned about mercury through like my own internet search. Like my neck was bothering me. I had mercury in my mouth. So that my story would be like,
That's how
it always is. Yeah, it always is,
Yeah.
You go through the same crap that, you study ultimately, and you get good at it because you were one of those.
So your neck started hurting, and that's why you started looking into mercury films.
Yeah, I thought it was just occupational hazard. And then you start to look at like, it was before AI, right? So Google probably gave me a bunch of articles to read in terms of.
What year was this?
So I would say 2010 is when I did my first meeting. So I've been a holistic or biological dentist for 16. So I would say like I was having trouble in 08, 09, probably. But I thought it was, like I said, occupational hazard. I wasn't into yoga as much as I am now. So I have a routine now to like bring myself back from the Quasimodo position of dentistry. And I try to be cognizant of how I'm like holding myself anyway. But, so that's what they teach. And now you come across, like you have to do CE. So you kind of roll with like, what's your
continuing education?
Yeah, right? Continuing education in my field has to be a certain, like we have to have CPR and the normal stuff that's required, but then you can go into another where you want to go just to get the credits. So, I learned a lot of technical things. I went to Pankey and I went to Dawson Center, which are beautiful, talking about occlusion and, the TMJ, very, very well defined parameters with how things should work, how God set it up and all. And then, I guess what happened when I learned about the mercury, I found a group, and it was the International Academy of Oral Medicine Toxicology, IAOMT. So that's where I got it was 16 years ago, because it was on like this weekend. It was like the same weekend, like 10 years or 16 years ago.
Is this weekend right now?
Yeah.
Wow.
Yeah. So coming up the end of this week, I'm going down there to San Antonio. Anyway, I didn't thank you for inviting me. I didn't do that at the beginning.
Good. It's all good.
Yeah. So my teachers are dead and younger than me and older than me. And I admire, like I have like all my books signed by teachers that have given me education. So
that's cool.
But I would say if you want to get into the things that were recommended to talk about in terms of being alienated or some kind of thing like that, we can go there.
Yeah, I want to talk about like first, again, with respect to your education, as much as you can share regarding what you were taught. Well, I'll just list a series of things and we'll go through them.
I like you bringing me back because
it's all good.
I want to answer the question, I don't want to sound like a politician.
No, you're good. You're good. You're good. And my brain works the same way. It's just like, oh, that threads to that. But that's my job is to bring you back. So mercury fillings specifically, like what you were taught, why they are used and why they're problematic.
Okay. Well, there is simplicity, I would say, in that they can work in a wet field, which happens to be where the way your mouth is with blood and saliva. So your isolation has to be more, you have to isolate for composites, So it was easy to use, like a new person. It was inexpensive. It served
because it was either mercury or gold, right?
Yeah. So gold so mercury, amalgam fillings are like, I like how they say silver fillings.
It's partially silver though, right?
Yeah,
so
it is, but it's 52% mercury and it's 33% silver.
Yeah.
And they call them silver filling.
That's very misleading.
Yeah, it is. It's like cornflakes really have cornmeal. Right. So anyway, so the whole idea of the structure was, it came out of mining. When they mine gold and silver and other metals, they use cyanide and mercury, but they leach through and it amalgamates or precipitates out into there are stories, like, I guess it's true, now with you guys, I don't know if history is true at all, all this stuff. I'm like skeptical.
Let's just assume that history is true.
Well, so you're talking about like the conquistadors and they came to try to find the city of gold. They find a lot of silver, but they have to refine it in the way they had at that time. So the Spanish actually had control over the mercury mines, not necessarily the silver mines and the money. So they use mercury to precipitate out over they call them platos or like these in Spanish, like you can picture long steps where it just keeps flowing down. So like they had like probably slaves in with brooms and stuff in bare feet, just,
standing
doing this
mercury,
stuff. Yeah. Then, so it would fall off and then they would get that and then they'd heat it and drive off the mercury. So that happens today. Like there's 60 million, artisanal mining operations happening right now
today.
Yeah, for gold.
Oh, for gold. Okay.
And they use mercury. And so mercury is another, like, maybe the layer is that it's organized crime. I have no idea. Whatever happens at these small, it's like, because like cocaine is a high yield, gold is a high yield. It's because people in those countries can like do these little things to make a living.
So what were you taught about why this is used though?
So going back to that, amalgamation came from that industry and then it was applied like by the French. I'm not gonna throw the French under the bus, but two guys came over from France and they did the first time mercury was used in Paris. It was like they say was the first MS case. So possibly related, I don't know. But anyway, that was just ease of use. In the field, you can do it. And then gold, you have to cast, you have to use the lost wax process. It's a little difficult to do. And it was expensive, or, either those two things, or you shuck the tooth, you take the tooth out. They didn't even have root canals back in the day, So necessity is the mother of invention. So like, that's why you started to get root canals. People started to think about, well, maybe we'll take the pulp out and we could talk about that more. But anyway, so all these things are taught at the level I guess the solution to the necessity was increased caries. So we needed to do more fillings and we didn't have composites yet. So that would be like the answer maybe from the technical part of it.
Why do you think so many dentists still offer mercury fillings today rather than composite fillings? And that could be a false dilemma too, which I want to talk about, but why do so many dentists offer that today? What could you imagine? I know it's probably hard for you to put yourself in their shoes, given you've been doing this for 16 years, but.
Well, from what I understand, like the debate is whether every dentist could do a regular composite instead of a mercury filling. Mm-hmm. You see how I say mercury filling instead of silver filling?
Right.
So doing a two surface filling, like when they touch, two teeth touch, that's technically difficult, but not something we couldn't do. Any dentist could learn how to do it. In fact, they do it with the mercury filling. It would just be substituting the material with composite, which generally speaking are very biocompatible now. Like the bisphenols are low, the plastics are low. They're making them we have ceramic type materials we're using now. But anyway, I think the reason they're still teaching it is because they think it can't be retaught, which is dumb. Like, you can't teach an old dog new tricks. That's not true, right?
Yeah. Or just be a massive undertaking to get this in all the dental schools or something like that. That's their excuse.
Yeah, I guess, but it's I don't know why things have to move so slowly. I mean, you see it with the food where they're taking out the dyes. It takes 2 years to take the dyes out. It's really the public should be, saying, let's I'm not going to buy it anymore.
Yeah.
Like, I know they were doing like whatever cereals that had the dyes in them, like $2 a box because they couldn't sell them. So they were sitting on the shelves. Well, that was the government gave the opportunity for the companies to change. And then the people started not buying it maybe. And that's what's happening now.
Well, that's why I really like, I talk with Vani Hari pretty regularly. She's great. Yeah, she's great. And like, she's feeling a little bit jaded about the political landscape right now. And I understand why. And when I chat with her, I'm like, Vani, you have to look at what you're doing a different way. What you're doing is helping to educate masses of people. And that's what matters most, because once they make different decisions, it sort of forces political change, because the political landscape is at some level controlled or influenced heavily, you could say, by multinational corporations. And if things are hitting their bottom line, they're going to change inevitably, even outside of government policy.
Yeah, she really even knew like the exact profit, and it dipped into their profit right away because people stopped buying it. So they have a thin profit model.
So we need the same type of thing like this with Mercury filling.
Yeah, I guess so. So that going back to that it would be too expensive. And honestly, I was telling you maybe before that we started recording there was a group of dentists that organized at the dawn of the dental school environment, right? They came right out of school. Hayden and Harris came out of medical school. They started the first dental school in Maryland. This is like the middle of the 1800s. And then they established an organization called the Society for Dental Surgeons. Yeah. Anyway, they vowed and they had a pledge not to use amalgam fillings back then.
Back then in the 1800s.
Yeah.
So they knew back then.
Yeah, and actually there was I swear I will not, I won't use amalgam filling. So I found old notes from their transcriptions.
Really?
That is all written up. And there was a dude who was like, there was an individual dentist that was in the group that was using amalgams. Like, no, you can't use amalgam. They were like, he was ridiculed, or like, what do you call it when you're
being ostracized?
Yeah,
essentially.
Well, not ostracized. He was what do they do in Congress? Like a citation or whatever. Like, if you're in a group, I can't get the word, whatever the word
it is.
Yeah. So he was
reprimanded in some way.
He was reprimanded. Like, and if he doesn't, he has to leave the organization. Wow. So he was caught using amalgam.
Well, that's just so wild though, because that just shows that they knew back then it was problematic. But I mean, I just wonder, and we don't need to get into this because that could get into the weeds quite a bit on how much of these acknowledgments occurred, because like homeopathy was very prevalent in the late 1800s, early 1900s.
Well, the whole
Flexner Report, Rockefeller medicine. That's why. Does that also largely apply?
It's so many layers.
I figured it did. I figured it applied to dentistry as well.
Because there were, like we would think about other forms of healing, like you just mentioned, they were just sort of pushed aside. All the natural schools went away.
Yeah.
So, I mean, conceivably, we could have had, if we had natural school, whatever you want to call them. There were homeopathic schools.
Yeah. There
were all these schools. If you had the same equivalent, there could have been a dentist that would kind of learn that way, if we were honest about it. And like, because the deterioration of the mouth, like Weston Price elucidated through all his research, was directly related to sugar consumption and lack of vitamins and stuff. So people like in the 70s started to avoid fat because of that whole myth, right? You've gone which is a wild myth. Yep. So then you're missing all your fat soluble vitamins, buddy. Right.
All right.
So that's the problem.
Do you think I wonder if dental issues became even more prevalent after there was this big push to eliminate fat from people's diets?
Yes.
For sure?
Yeah.
Wow.
And, like high fructose corn syrup was introduced like in the 80s. That's when heart attacks went like this too.
Yep.
So like all the things kind of corresponded to that. I mean, edentulous, like a full arch being edentulous, that existed from another standpoint, probably hygiene issues. Yeah. We didn't have brushes like, you have 30 brushes you could pick at the supermarket, so they taught like the original, like I found a book, this dentist who was a teacher, like I'm trying to teach this stuff to you guys. He was a teacher. He wrote a nice little book in like 1922 about how the teeth worked, what you need to do. But he had brush your teeth 4 times a day.
Wow.
Which is really cool. And then go to your dentist every 3 months, which is really cool too. But then the Crest brought it in a commercial, I think, see your dentist every 6 months. So then that became the pattern. But anyway, yeah, like I know a lot about the history. Yeah, it's ridiculous. Some of it. Yeah.
I would like to talk about root canals. I mean, there's so many things that I want to talk about too. Fluoride, I would like to get into that as well. You saw my notes. I have so many things. Braces, orthodontics. So let's talk about root canals next, if we could. Do you think, because I've heard this before from another biological dentist, that root canals are sort of pushed onto people before they may or may not be quote unquote necessary? And in some cases,
that's a good conversation to have.
Yeah, I would just love to hear your whole take on root canals.
Because I like that. Why does a tooth need a root canal? Kind of the etiology of it. Well, it can be from trauma, like grinding, clenching, from getting hit by, if your
athlete,
your little ball hits you in the face, you used to hit against the wall.
Yeah, I got elbowed when I was playing basketball.
It's bad.
Yeah, and that's what
injuries. So trauma can be also like that direct trauma, which is a physical force, but it can also be your own dentition working on itself at night. And that's called bruxism. The nighttime bruxism or grinding your teeth is actually increasing because of the airway problems. So we could talk about that.
Yep,
with the
I
airway.
have that on here too.
But it also increases like with serotonin uptake inhibitors, some of the
serotonin medications.
Yeah. So those things are causing, like, there are not just illegal ones, meth or something like that, but when they're messing with the serotonin, it seems to cause
like common prescribed SSRIs that people
again, like, I'm trying to be diplomatic about how I say things, but most people don't get told that, and they don't read that big piece of paper that says bruxism, and they don't even know what bruxism is, right? So you need a night guard if you're on those medications. Like if you have depression and you're on something like that, you need a night guard. Like these are the things I would like people to know, teach people that. A lot of people, we identify, like on their first exam, we identify grinding very quickly.
Interesting.
Just by like the shape of the teeth, you can see it. You have buttressing bone, which is the body like responding to a force that's not really the right forces on the teeth or too much. So like at night, well, during the day, if I measured it, you could go 250, maybe 200 pounds per square inch. But at night, it goes up to like 900 pounds per square inch.
No way.
Yeah, and you can totally break any kind of dental material, if not your own teeth. So the body starts buttressing, putting bone, like a lot of people have these tori, like mandibular tori, the little bumps that stick out of bone. That's just the body responding to the forces that are hitting them. And they're called parafunctional. They're not really supposed to be. So you can see almost, you don't even realize this, but I guess I got a camera on me that show, but you grind from this side to that side so far that your canines it'll slide up and over your canine. You bring your mandible all the way this way, all the way that way, and then you start clipping the front teeth. So a lot of people could identify, like anybody who's watching this podcast, you'll be able to identify your friends and family with bruxism if you see flat teeth and sharp edges on the canine or flat canines. If you have a flat canine, that's not the way we eat.
Right.
So, I mean, there are malocclusions. The bite can be different in different populations of people. You can have a jaw that sticks out more.
Yeah.
Those things. You can have edge to edge, which is common in some cultures too, some societies. But
is there pretty distinct patterns amongst societies as well with respect to like how their jaws are?
Well, you might see more common, like you see supernumerary teeth in Indian, native people.
Yeah. What does that mean,
multiple teeth, like weird places and extra teeth and stuff. And then in in some Scandinavian country, you don't even see wisdom teeth. So like it kind of varies like that.
Really interesting.
Yeah.
Okay. Those are interesting patterns.
Get me back on the lane.
Root canal. Yeah. No,
yeah. So the reason they can come into being is because mostly from caries, from decay, dental decay, which is another nutritional problem. It's a systemic problem. It's not just that you're eating sugar. So that we can
because that's what most dentists think today, correct? That it's primarily sugar, and then the bacteria feed off the sugar, and the byproduct of the bacteria is what's causing decay in teeth.
Yeah, let me quickly talk about root canal. So if the bugs go into the canal system, then you have to do a root canal or take the tooth out. 2 choices. That's it. So, but that's what I would say about that. And we can go into what the procedure is later. But I would say the caries thing is really good to talk about because it does involve the nutritional aspect again. So now we think acid, so I always like to say the microbiome in the mouth or your biofilm, which is, there's like 9 different places where they're looking at all the bugs, like your cheek, your palate. So your gums are different than your tongue. And now we're tongue scraping and we're water picking, or all these things to try to change that biology to like, well, you guys know the terrain people. I love the terrain people on this podcast. There's another one I like, Diaz and all those guys. But anyway, the whole idea is that plaque is good until it's bad. Plaque helps us until it doesn't. And it is what Weston Price was seeing, like, why do my patients have periodontal disease? Why are they bleeding? If anybody in the audience now bleeds when they floss, they have inflammation. So you're not supposed to bleed when you brush. You're not supposed to bleed. So anyway, that's local factors, but caries comes into play from acid, from like direct acid, like the drinks we have today, like Celsius, all that stuff. Oh, I mentioned the brand name. Sorry.
That's okay.
Beep.
People would rather hear the brand names.
You can go and look at acidity of drinks. I mean, that's something people should do, like a clean drink. Maybe we get a Way Forward K2 drink with like no acid. What we want to do is think about caries as systemic. Well, what's systemic? Not having the proper nutrition, the K2 again. And now we know, this is crazy. No one knew this a few years ago, that the parotid gland, which is mostly your saliva, is right here produced. And K2 goes to the parotid gland. Then the parotid gland releases a chemical. I don't even know all the biochemistry, but to the brain. And the brain brings a blood flow and produces a fountain with the teeth resisting plaque. So there's like a pressure that comes off. K2 is in like odontoblast inside the cell, and it calcifies the tubules on outside the cell. So it does so many things with dental, as well as bone. So it's the K2, it's the acid and the blood and the bugs themselves producing acids in combination. But it is the sugar that the bad bugs enjoy, that they proliferate, and then they poop out all the acid that changes the whole pH. So you have so
it's really even like at the root though, just to comment real quick. It's not even the quote unquote bugs that are the issue. It all goes back to like what you are consuming on a daily basis that is the issue.
Yeah.
Yeah.
Yeah. So the microbiome is influenced by the sugar, by insulin resistance, things like that. So diabetics have in the fluid around their teeth, in the gum, that crevicular fluid is representing what's in the plasma. So it's crazy. So there's a party going on when the sugar comes out into the sulcus, and all the bugs are like, there's 700 species of bacteria enjoying that new sugar. And then the dominant force, the dominant ones that like sugar will outcompete because they use that substrate quicker. They use it quicker. So anyway, that whole thing it's not just like acid on the tooth, from the bugs. It's not that, but you do have to reduce the plaque, the pathogens that cause decay by brushing every day. Mm-hmm. But in dental school, we used to learn, like they probably still teach this maybe, I hope they don't, Listerine, it wipes out everything. So you that's not good because you don't have the complement you need. Like we know certain bacteria release nitric oxide, which is good for cardiovascular disease, and also kills the anaerobes because it's oxygen. So anyway, it's like all this stuff. I was a physiology major in dental school too, but I didn't finish my master's, but I love physiology. And I always talk about form and function of a tooth, getting back to your root canal thing. The form and the function of that tooth, what was built a certain way to do a certain thing, like your femur, right? So if the femur didn't have that bone on the outside, you wouldn't be holding yourself up, right? So that tooth is designed in a certain way. It senses pressure on it when it has its full blood supply and lymphatic system. And it's actually a capillary bed that's kind of unique. It's kind of it reminds me of like the Spanish moss or something when you look at it. It's a lot different. It's not like one thing coming in and one thing coming out. It's very much its own deal. So that form and that function of that was designed to like give information to the tooth, even from the standpoint of pressure on top. Once you lose that pulp, you lose some of the function of the tooth, right? You lose that fluid flow that I just described that resists plaque, which I tried to articulate. So that fluid flow is lost. Okay, so that becomes a different thing. Also, we think teeth sense, the texture of food, maybe bring on the enzymes that we need for that. That's a cool idea. That would be good with the community. They would enjoy that, idea. Like, oh, here comes a nice Canadian ham or something, right? The texture and so it could be, we don't know. I think even smell does that. We know
of course.
Smell does that, starts the stomach acids and stuff. I mean, we have a lot of things happening with teeth from the amount of pressure. So your 6-year molars are like, well, if you chew right on your 6-year molar, which is your first molar, it seats the condyle into the joint. So malocclusions are when those things are not accurately hitting. So if there's a discrepancy in like the normal, so the teeth, muscles, and the joint are all like in harmony. A lot of it's like that, homeostasis of the biome, homeostasis of the joint. Homeostasis is really about like what you guys teach too, is like get centered when you're all stressed. Mm-hmm. So anyway, when the tooth loses this is why I come from. Why are root canals? Why are they happening? Because eventually the pulp dies, okay, from whatever reason, whether it's trauma, caries, a number of reasons.
Even previous dental procedures.
Yeah, that's actually a good example. A filling, another filling, and another filling.
Yeah.
And recurrent decay happens because they continue to eat the stuff that they're eating.
Right. So
you have a filling, and then they do a new filling around it. Sometimes they do swap out another mercury filling too, so it's another insult there. But the mercury vapor comes off of fillings 24/7, depending on like the heat, the stimulation, if there's friction, so that it also goes into the tooth. I'm sorry. Yeah, the vapor goes into the tooth also. By definition, it's coming out everywhere.
Yeah.
So often you see gray. You could see gray in a tissue. That's amalgam tattoo. That's actually a combination of a vapor interacting with a pathogen that produces sulfur, like sulfur dioxide, or sulfur compounds like mercaptan, which is, natural gas has a smell to it. But anyway, that combines and forms this gray tattoo. So anyway, there's a lot of stuff going on, but ultimately when the tooth is dead and doesn't have the blood supply, there's the odontoblasts die, and those odontoblasts have like the cell bodies inside the tooth, like on the inside the pulp, and it shoots out to the outside where the ligament is, periodontal ligament. There's like these tubules. There's 15,000 tubules per 1 square millimeter. So that's how many there are, and they vary in terms of how many there are depending on the construction of the cusps and stuff. So they're all littered through the root system. And so once there's no blood flow there, they're fallow, like they're open, and the cells die. Then bacteria can migrate in there because there's no as much resistance. And then they kind of get out of the immune system, get out of the blood flow, and they find their own little condominiums. That's what I say about root canals. And I say when we find out, like Weston Price did find out that they were bad, or in the way that he did, which I could talk about. But now we know the DNA around these guys. There's like 100 different bacteria we look at, and the anaerobes shouldn't be there. And I was trying to emphasize this with my coach, Zach, yesterday. But I was trying to tell him, why it's bad, because bacteria migrate there that wouldn't otherwise be there. And we were talking about chicken and the egg, you know. So the tooth dies, and why are there bugs of that nature that are from our gut in your mouth? Right. Well, so there's one called fecalis. What's that sound like?
Fecal.
Yeah.
Poop. Yeah.
So they release those chemicals that you smell. So people say I have a bad taste. Often it's from them. It's
after they've had a root canal.
Yeah, because the ligament is hard bone, and it's sitting in this like a socket is like little rubber bands attached to the tooth. And they vary they vary where they are. And actually that's why when you chew, you strengthen your bone. You're chewing your gum now. You actually you're like the tooth's in a little trampoline, and that stimulates the bone. It's like walking. That's why we need to move more. Move, your skeleton needs to move. But anyway, that that ligament is the only thing detecting like pressure on it now. Cause I told you about the tooth being devitalized. It doesn't know how much pressure. So we see them break because they also are denatured and they get dry. So it's not like there's no dead thing we leave in the body. You know, if your toe was, if you had a diabetic toe, I forgot to put my sneakers on.
It's all good. Be comfy in your
I guess
socks.
I was nervous.
No, it's okay.
They look good. Anyway, if you had a diabetic toe, and they basically wait until they can get blood flow back. If they can't, they're using leeches now and stuff. They're trying different things like they used to do. But there's anticoagulants in the leech, and the blood flow gets back, and they
wouldn't leave a decaying, like a dead thing on the body.
Yeah.
Yeah. And see, this is what coming to understand the terrain position, and especially like pleomorphism and the role of bacteria and fungi in the body. I wonder if root canals become problematic, and we've, even like biological dentists have understandably come to think that it's the bacteria that is problematic in that case, when it's the reality is we're sort of encapsulating and leaving a dead thing inside of the body, connected to the body. And those bacteria proliferate in order to decompose decaying tissue. So it's not that the bacteria itself is problematic. It's that the bacteria is there, and the decaying tissue that we're leaving there is what's problematic.
Yeah.
Because if you get rotting necrotic tissue and, organic material stuck inside the body, that's going to be problematic to the body. You know what I mean?
Well, you look at a dead tree. I mean, it's what's happening there. It's sad to think about it this way, but it is it's festering kind of, it's a septic event. Like it's like a, I don't know how I don't want to offend endodontists and people that do these things, but I think you have to be cognizant of the facts, the facts in the matter.
Yeah.
It is a toxic situation where there's Dr. Tom Levy, who's a cardiologist. I know him. He's a friend. Probably doesn't know me. If I saw him, I would say hi. But anyway, he's a mentor. He's a cardiologist and a lawyer, and he's written several books on root canals. So I usually quote him. It's kind of like if you want to take a pass and it's not me saying it, I'm saying it from him. I'm paraphrasing him. He thinks it's connected to, or it's causing heart attacks. I mean, that's what he says. And that's what he says, and he backs it up in his book. His several books. So all the problems that exist in periodontal disease, we're very honest about. Periodontal disease causes this, causes that, causes this. But an abscess under a tooth, I have my prop. Can I bring my prop?
Yeah, please. Show your prop.
Here's my prop.
Narrate a little bit for those who are only able to listen to this episode. Yeah.
So I have a tooth in my hand, and where the normal gum would be around where you see the enamel, and then you have a CEJ, or where the enamel ends and the cementum on the tooth root begins. This is where I said all the tubules would be. So as you have a bad taste in your mouth, it'll leak down the ligament here and it'll express out the edges. That's why we see suppuration, which is pus. So we'll see that's where the immune system can notice there are bad bugs in the mix here, but the gum comes off of here. Then you have your bone, of course, surrounding the whole thing, right? The bone is intimate with the gingiva, or the gums, and the infiltrate. That's what you said. We were talking about septic situation. It just starts to leak into that area. So it's like toxic shock syndrome, but on a small scale. If you remember, people who don't know what that is, it's like a longer standing tampon, I guess, would be what we just say a couple days or whatever. Anyway, there became too much abundance of lipopolysaccharides or toxins, and then that all of a sudden got into the bloodstream, and the person would die from cytokine storms that we talk about now. But this is a slow kind of infiltration. So you do have those organisms in your blood, and you have their products. So you have the mercaptans, and mercaptan might be even clotting. That's where Tom Levy brings in the cardiovascular stuff, because he says these bugs produce toxins that cause clotting. So
most of our modern lives are spent completely disconnected from the natural world. Artificial light environments, concrete, rubber soles on our feet, non-native EMFs everywhere. We have totally immersed ourselves in a completely unnatural world. Getting outside and putting your feet on the earth is actually vitally important for our health. And that's why I've worn Earth Runners for years, especially when I'm out in nature, whether I'm on a trail, hiking, fly fishing, camping, or just spending time outside at an event like Confluence with the earth beneath my feet. Earth Runners are minimalist sandals that are especially great when you're out in a natural environment. They have a wide toe box and a flexible sole that lets your feet spread, grip, and move naturally on uneven terrain, whether it's trails, grass, sand, or dirt. Instead of restricting your feet the way most modern footwear does, they allow your feet to engage naturally with the ground and move the way they were designed to do in a natural setting. What also makes Earth Runners unique is their conductive grounding design, which allows your body to reconnect with the Earth's natural negative charge while you walk. And as I've discussed on a variety of podcast episodes, negative charge is essential for your body's energy production. If you value getting outside, reconnecting with nature, and moving in a way that your body was designed to move while on natural surfaces, check them out. Head to earthrunners.com or just head to the show notes and use code FORWARD10 at checkout for 10% off. Again, that's FWRD10 for 10% off your order. If you're ready to rewild your health and walk in deeper alignment with nature, then check out Earth Runners and feel the difference from the ground up. Well, it makes sense if the bugs themselves are feeding on rotten flesh, like rotting flesh in a place that's not appropriate. Like if those bugs were in your stomach and your stomach you've consumed rotting flesh in that respect, that's a completely different context. If it's in your mouth where it's not supposed to be and those bugs are consuming rotting flesh, I would imagine it's not that the bacteria are the problem, it's that the byproduct of that as a result of you having rotting necrotic tissue inside your mouth is the problem.
Actually that's a good why I talk about the GI a lot, and you were asking what is a traditional dentist compared to a biological dentist. I ask if you poop every day.
Yeah.
We joked about that on a call one time, but it's true. Like you have to have that waste leave. Yeah. And flatulence can be bad and they sometimes aren't that bad, but it depends on the bugs in the gut too and how much fermentation's going on. We talk about transit time, which is kind of funny to talk about, but on the call, if we ever do a call like an open mic or open call, like would be fun, but you could take beats and you can see when they leave, and it's disgusting. Zach and I were talking about it's gross to know, but you have to know what your body's doing. Yeah. And so it should be out your body in 24 hours. I mean, it should be the next day. So if you're not, I have so many patients that are constipated because of a number of reasons. I mean, a lot of times thyroid function is off and it causes constipation, dry skin, losing hair, but you cannot have stasis in anything. That's kind of the problem with, gallstone, gallbladder, your station tube, any place where there's stasis, there's bad things that happen, heart attacks. So anyway, that's what I would say about that whole thing. So the bugs go in the bloodstream and then that's a problem. So you're living with chronic infection, chronic inflammation, which brings like free radicals and all the other stuff.
Well, so I have a couple more questions related to root canals too. For those who've had root canals already, what do you as a biological dentist typically recommend?
Okay, so now you got the cake with a root canal. So this is my cake thing. Yep. It might work. I don't know if it's going to work. Mm-hmm. And we can make a cartoon version of it.
And obviously it's going to be like a case-by-case basis, but generally speaking, what do you typically see?
Well, the thing that I would say is, can it be replaced without too much trouble or just eliminated? Because we know, I think you have to look at systemic problems people are having. Obviously, if they have same side problems, we were talking about the meridian chart, and
well, it's wild for me, just for the people listening and watching. I had a root canal here, and then the tooth cracked, fell out, and I'm missing a tooth now there, and I do question whether that dentist.
This is actually number 3, so you can put that in there if you want.
Yeah, just toss it right in. I love that. This is very heavy. That's very nice. He gave me a prop to hold. That is the exact tooth that I'm missing. So for
now,
me,
you guys would say in the way forward, is that meant to be? I mean, was that
I would say it was meant to be.
Was that predetermined that I'd have this number 3?
Of course. That's of course that you have that.
Unbelievable.
On the right side too, specifically?
Exactly.
Yeah,
exactly.
That's pretty wild. That's pretty crazy.
I mean, tell me that's not.
No, of course.
That's good for the community.
That's it right there. What are the odds of that? But on that note, for me, it's wild that I do question whether the dentist that extracted the tooth after it cracked did that in the proper way. Because I would imagine if you're not trained in this sort of biological approach that there is some issues. Like maybe there's still some, rotten material that was sewed up inside this socket right here. And then the second thing that is so wild that we were talking about before we clicked record is that I've had gut issues basically my whole life. Yes, I was on antibiotics quite a bit. Yes, I've been administered a number of vaccines. No, I did not take care of my diet. When I was younger, I've had a lot of psycho-spiritual / emotional stress-related things that correlate heavily with gut-related issues. So there's like all these factors at play, but it is really interesting that you pointed out this tooth that I'm missing is literally the tooth that's on the gut
How about
line.
your shoulder when you lift? Is that on the right side? Do you have any weakness on your shoulder?
I don't have any weakness on my right side. My left side, though, I have 2 screws in my left shoulder, and that's a whole separate thing. But it's just interesting that I've had gut issues my whole life, and I'm missing this tooth. And I originally had a root canal on this tooth. I've had a lot of problems with that tooth. So
yeah, Chinese medicine, they'll actually palpate the body and they'll look at, you have the meridians, and then you have like the pressure, the electrical system that we know is right under the skin. It's kind of crazy, right? So it makes sense but they could reverse diagnose that, like saying like, oh, like if they're on the triple warmer or something like that, and they could say, do you have a problem with that tooth? Like they'll do it the other way.
Yeah.
But so in that, we could talk about your situation.
Well, let's talk about specifically for those who still have the tooth.
Yeah. So I would just tell you what I say biological extraction.
Yeah.
And I say Band-Aid, like biological Band-Aid. We're trying to speed up all this stuff. So, So yeah, that's a great, it brings in a couple of things that I have like technology wise in terms of what we're using now. And biological dentists, a lot of them use platelets. Have you heard that?
Yeah. Is that
so
like
there's
similar?
A growth factor.
Okay.
Yeah,
I was going to say similar to stem
they
cells.
use them in joints and stuff too. But for all intents and purposes, they're a isolate from the blood that we
PRP?
PRP.
Platelet-rich plasma. Yeah. I've had that in my shoulder before.
Yeah. So we spin it down in the office. I have a phlebotomy person. And what that has is God gave you these cells that produce growth factors, and they delay release them. It's like, the little thing you put in the fish tank when you're going away, like that kind of thing happens, right? For 6 to 10 days, you have growth factors in the most important time period, which is you have an injury or, tooth removed, and then you have inflammation followed by like infiltration of white blood cells and all these things, fibroblasts. All this stuff happens in a known order. And all it does is it squirts that it shortens that all those series of events through the growth factors being there right away. So you have like I call it a biological Band-Aid, but those platelets are like, we call it sticky bone too, because you can add bone, like the patient's bone to it. But it sticks up in that clot. So it's a clot that would have formed normally, eventually. But it's clean of red blood cells. It doesn't have to be cleaned out. It's just platelets, beautiful platelets, right? So it's asking for angiogenesis, which is blood vessel formation right in the edges, and then right behind that are bone coming in. So you're trying to get the goal is get the tooth out if that's what people choose. I always give people choices. I'm never going to tell them to do anything like take their mercury out, but or a root canal. But if they want that done, then that's what's going to happen, right? We're going to use we're going to bring light to the subject. It's dark place. We're going to bring light. We're going to bring blood flow back. So we use ozone. So we take the tooth out. I try to take it out very safely, section it if I can. I'll section it, take the roots out. Like in that case, I section the tooth like this because, it doesn't want to come out straight, see? So we have to section it. Anyway, once that's removed carefully, we take the ligament, which I told you about. So that sometimes people feel like it impedes healing if you leave it. So there are people that talk about taking the ligament out, and we try to do that. And then we infused it with ozone gas, and that brings the blood flow. So we can have like a very stagnant place, which is like needs some light, needs some oxygen. Yeah. So you start that whole process by I can use round burrs, and I also have a piezo, which is uses a diamond and vibrates instrument. It actually is it's safe when I'm doing surgery here because you could put it up against a nerve and it won't hurt it.
Interesting.
It was developed for spinal surgery in Italy, I think. And anyway, it sounds like Italian. Piezo, sounds Italian. But anyway, so then you clean that out and you get the blood flow, you get this crimson blood coming through, and then you put your platelets in there and we suture it in. But that's called like a revision is a way you can say. And my girlfriend Robin coined the phrase decavitation, which I didn't even use decavitation. So it's a cavitation that's you're revising. And so when you revise a cavitation or that kind of area, you're getting rid of the fat, fibroblasts, nasty cells, dead tissue, like you said. Well, the dead tissue is coming out. Ozone really like oxidizes areas of, and it goes into acidic areas and like nasty areas. It reminds me of like Melaleuca. Oil is supposed to go into like debris areas. It's supposed to go in, drawn into it. So oxygen in that particular, it's very reactive. I don't know if you know what ozone is.
I do.
Yeah. So I lecture about ozone sometimes to people because it's my gateway into like traditional dentists. If they learn about ozone, then they start to learn about other stuff that biological dentists do. So I could talk about it because you can use it for caries all the disease processes in the mouth we can use ozone for. But anyway, it does travel. It's supposed to travel like in the catacombs of the bone, right? Maybe 2.5 centimeters. So like it's going here, it's going places, but it kills everything. And I won't say kills viruses because they don't exist. I mean, I guess, no, it does kill. It can't, bacteria can't defend against it because bacteria don't have the oxidative stress antioxidant capacity on the outside. But that's part of our technique. But as far as patients who are like getting ready for that, they should have their D levels checked to make sure that they're eating whole foods. If they're eating garbage and like, it's like you want the tooth out, if it's an emergency, we do it. But we try to talk to people the whole way about food. Like that's my one thing I probably talk to everybody about. Like almost every patient coming in, I'm chatting about eating whole food. And I put the day that the Maha put the count, they turned the pyramid upside down was in my waiting room the same day. Yeah. So I believe in.
Do you think that's pretty accurate from a like biological dentist approach, like nourishing traditions approach on?
I think people need. This is why there's so much nuance and stuff. That's why we have to have conversations about this stuff. Like people are getting bent out of shape about the pyramid, but Paul Saladino, which I read his book, he's great, stuff he talks about, but it is the plant, the chemicals that are defense chemicals we have to deal with, like phytates, oxalates, we have to deal with them. So fermentation, that's what we have to talk about. That they didn't really talk, they talked a little bit about fermented food, but they don't say why. They should talk about why.
Got it. That makes sense. So applying it back to my situation, and I'm sure there's plenty of people out there in the audience who've had a root canal extracted. It sounds like based on what you're saying at the end, if you've had a root canal in your tooth and had that tooth extracted afterwards, it still might be wise to get that area checked out by a biological dentist if you're noticing problematic things occurring with respect to your health related to that, right?
Well, what I would say is like that whole how it develops. Like if you think you still have,
this is 15 years ago now.
Yeah. So when I describe the biological extraction, that's kind of what has to happen if you wanted to make it right. And you have to be, that's why I said vitamin D, you have to have the ability.
That's helpful for me to hear because my intuition has been correcting because I'm like, I feel like whatever was done when they extracted this tooth that had a root canal on it, it had already fractured. So there was like a piece that fell out, but I had this intuition that whatever they did, it was not.
Well, there's an infiltrate in the bone. A lot of the toxicity is in the tooth itself, but there's some infiltrate into the bone. So that has to be dealt with. But like 15 years ago, people weren't doing what we're doing now with platelets. So, and they could have used ozone. They could have, but that was held back too. That should be in every dental office in the world.
Yeah.
It should be. I use when I'm doing a filling, I'll do the dentin and just nuke the whole thing right before I do the filling, so we kill the bugs. And potentially, there's a theory that like if you left a little, so I can avoid a root canal. You were talking about avoiding. Like I'll go as far as I can and just start to look at the dentin. Does it look like it's contaminated? If I'm really close and I want to avoid it, I'll just hit the ozone on there and kill it. And it's So there's a funny thing that happens with the body walls off decay. So there's a chance, you know, if you have really deep cavity, that it's always walling itself off.
Yeah.
It's the pulp, because there's a secondary dentin, tertiary dentin that gets laid down. So it's protecting it. But there's a chance, like, so there's infected dentin and affected dentin. So you get to this one area, this zone, and you're like, maybe the soft stuff's gone, but we're getting close. And then we put like a basic kind of material that would kill it too, and stimulate the pulp. But yeah, I mean, avoiding today, you should have that taken out and have platelets and have it done properly. Doing a revision later, like fixing it later, isn't hard. So it can be like if you came to see me, yeah. But not everybody does this stuff that we're doing. I'm literally like flabbergasted at the things I'm doing now. Like if I look back, you know, my 8-year-old stuff for sure. But you know, even when I first started, like I never would have thought. I started not doing amalgams because they're ugly and people don't like them. You know, so aesthetically they weren't pleasing. And then that's when I started to roll into the whole, I'm not going to do them anymore. And you also asked about why they're still done, and it has to do with insurance too.
Interesting.
And I don't want to get in the whole thing, but they pay for it, you know.
Right.
They used to actually downgrade my composites that I only did. I didn't do amalgam, but they would downgrade them to an amalgam fee.
Wow.
That's another, not a conspiracy, but it's another thing that's a fact.
For sure.
So why is it that way?
Yeah. Why do insurance companies dictate like specific? Yeah. It's interesting.
Yeah. And like I said, I'm an ADA member actually still, because I have life insurance with them, and I want to be a squeaky wheel if I can I have friends that are really high up in dental, in the dental societies and stuff. And I said, I could be there with you if you ever want to talk about this, you know? Yeah. So
are any of them?
Everyone's seeing like things come to fruition. I was talking about this many years ago, where I was getting heat in the newspaper and all that kind of stuff. So
yeah,
it wasn't a big. I'm making it sound dramatic, but someone wrote an editorial about like amalgams are safe and effective.
Oh my gosh.
You know, and that no one should be telling patients about that. So the freedom, that's the other thing that resonates with me. Your health freedom.
Yeah.
So like in Philadelphia, dentists were trying to say, well, if you're going to get amalgam filling, you should really know what it's all about.
Yeah.
You know, and they were honest about what was in it.
True informed consent.
Yes, informed consent. Yeah. It's not just the money and the.
Yeah, of course.
Anyway, they went after people like that because they were pushing against the status quo, right?
I'm so shocked that they went after people like that.
Well, Hal Huggins lost his license.
I mean, it doesn't surprise me at all. It doesn't surprise me even a little bit.
I want to be a dentist, so don't come after me.
Yeah. Yeah, we need dentists like you.
Well, it's all out there, this information. It's just we're like kind of coming together and talking about it, like fireside chat.
Yeah.
You know, at the way forward. This is the dental way forward. I tried to pitch that to you, but
didn't work out. No. Almost there.
The way forward dentally.
Yeah. What are your thoughts on implants? So let's talk like someone who's had a tooth extracted, or just in any case, what are your thoughts on implants?
Well, it's like the necessity is the mother of invention again. If you have a missing tooth in the front, you can do a bridge. You can kind of bridge it.
This tooth is half fake.
Yeah.
This one.
I know.
You could tell? Could you really? You could tell right away? How? Just because of the discoloration?
I could just see it, yeah.
Yeah. This tooth is half fake.
Anyway, if you work, if you're a dentist, or if you work in dentistry, you look at your people's mouths. You just start to go.
See right away.
Yeah.
Yeah.
Like if you watch Seinfeld, Kramer, or not Kramer, the other gentleman, he always laughed like this. You know, Newman used to laugh, and you see amalgams, and then
everywhere, and
on MASH.
Yeah.
Hawkeye had amalgam. You could see him. So that's the kind of stuff you can see when Tom Cruise always clenches when he's acting. You know, you see stuff like that about the face and the.
Yeah. Interesting.
Yeah. But I don't know where we were.
Well, just your thought on implants.
Yeah. So necessity, mother of invention again, you know, and it's like, how are you going to get a tooth? Ultimately, you say, let's do no harm, right? That's what I say. So if there are virgin teeth that don't have any fillings, and you lost a tooth in between, like you might not have any fillings on either side, but I don't want to cut a bridge down for that. So maybe I'll put I only do ceramic implants.
Can you share why on that? Because I think that part is really interesting.
If you cut a tooth, there's a chance that you could kill it. Like even with the cold water and it's slow and good diamonds and all that. And technically, savvy or whatever with how you do it, not rushing and all that. But you can insult the tooth. Like I said, you can insult the tooth by hitting it. But if you heat it, I mean, this is why people who smoke crack and meth, and when they have high temperature on their teeth, it kills the pulp just from the temperature going up. And also the vascularity decreases too because of vasoconstriction. But anyway, that whole thing we were talking about before.
So why specifically the what's the material for the implants again? It's called
so I
ceramic.
use,
Why specifically do you use ceramic implants?
I know where we were. We were talking about cutting teeth that are so if you have a nice tooth, you don't want to harm that tooth by cutting it down just to get a cap or a crown over it. So that's like this is kind of like maybe we need to rethink some dental ideas. Like even avoiding a tooth it's always sensitive, but you're grinding. I'll look at the bite first, adjust the bite, and you need a night guard before you get a root canal. Try to avoid it. But in the case where you have one missing, you don't want to cut those teeth if you can help it. So our most of the dental implants are titanium with a nickel. And
what are your thoughts on those?
So because people have allergies to nickel that are undiagnosed, I mean, this is another thing that's missing in our blood. Our blood chemistries, we don't really test for nickel. We should. I mean, you could do a quick test where you put an actual nickel on and tape it to your ankle and see if it's, but.
Or even muscle test it too.
Yeah, muscle test.
Yeah.
But I say that there's a problem because of the current, it's a negative charge. So teeth, they tend to wick in the bacteria that are, and then they develop, once the threads are, there's a whole lot of problems, but I guess, it's one of those things you have to weigh the good and the bad. It's different than, to me, than maybe pharmaceuticals or fluoride, it's too close. Fluoride's too close to being toxic at the doses we're giving it, where it's neurotoxic. So, but this can be tolerated by people, but again, then you talk about the multiple metals, maybe more than one. You have a shoulder thing. Some people have a toe thing. And there's galvanism, which is the current actually traveling through these things. So amalgam is, 4 dissimilar metals. You only need 2 dissimilar metals in an aqueous solution to make a battery. So it's a battery. So 4.
We're not talking 4th phase water battery, by the way. We're talking a leaky toxic battery in this case.
That's a leaky toxic battery that just walked in the office. Yeah. So that's what happens with the dissimilar metals. But there's a charge and there's a current, and often it's like a higher charge than even your brain is. So it can be a problem for people. You know how there's electric sensitivity?
Yeah.
So we have a lot of patients that are electric sensitive. They're also intolerant of phthalates and the smelly stuff, sticky stuff.
Gosh, I just wonder with non-native EMFs, how much interaction there is between amalgam fillings and that, or
Yeah, I looked up the Lucille Ball story to tell because I looked it up. Oh, yeah. Did you want me?
Tapes.
Did you want me to?
Oh,
yeah, it was in there. Well, I kind of did a little bit of a deep dive. What do
you think about that? Because I should have written that down.
It's pretty cool, but I think she
share what it was first though, because this could be going over people's heads.
Evidently, and she liked to tell the story because it probably freaked her out.
Yeah.
So she's rolling through the Hollywood Hills and comes past a radio station, and conceivably, so I looked up Grok, Grok told me you could have the metals actually so the metals that are in the mouth possibly could be a transistor or the things that would receive.
Yeah.
So it's possible.
Because she was hearing the music in her head.
Yeah. So they don't so I found, how they scrub really what could be the truth.
Yeah. Of course.
So it's possible, based on chemistry, that she had at least some kind of, tonal, like your speaker with a little bit of bass or something where she knew maybe it was a melody that she actually recognized. And so it became, maybe she thought she heard the radio.
Wow.
I don't know if it was, if she exaggerated that she really did, but it happened to her 2 times, so the same place, so that's where it probably wigged her out a little bit more. But evidently she told the story on cars, on night light shows and stuff. And
that she could literally hear music inside of her head because of the type of implant or filling that she had.
Filling. It was probably just mercury fillings touched and gold. So you can have more galvanism. So actually people know Dr. Pompa as a chiropractor. He's on the Maha. He's a friend of mine. And he talks about situations where there's metal. I like him talking about because he's a chiropractor. I like to spread the word, like they finally talked about these things on Maha last week, and I was like so happy about it.
Cool.
But anyway, when you have a gold filling, so you have a gold crown, which is not just gold, it's like palladium and other metals, and then you have that against another series of metals, you got a battery, you got some stuff that can really affect these electric sensitive people. So and they're like intolerant of smells, electricity, a lot of things.
Interesting.
It's really like they're canaries in a coal mine.
Yeah.
Canaries in a smart home or canaries in whatever world we have now.
Right. Right. So it's just,
and they tell us a lot, they're the ones telling us, it's like the telepathy people, they're telling us things we humans need to know and we're like ignorant of.
Right.
And they're telling us that there's a real thing. So like I thought of something. If everybody saw mercury vapor, we wouldn't have mercury in our mouths anymore.
Right.
Because why would I talk to you if you had green mist coming out of your mouth?
Right.
That's theoretically what you have to think about. So EMF is the same thing. It's an invisible energy at kind of a bad, like I don't even have a microwave. Like it's at a level where the energy is kind of crazy. I mean, and unfortunately, like even supposedly, I don't know if this is true, but supposedly other countries have lower levels, a lot lower levels, like even Russia and China.
Yeah.
So I don't know. I don't know why we're doing it. I mean, I think I know why, but
right.
I'm talking about dental today and trying to stay in my lane.
Right. It relates though.
But I like to talk about food, out of my lane, but it's in my lane.
Since we're talking about amalgam fillings a little bit though, I forgot to ask this. What are your thoughts on those who've had them getting them revised?
Yeah, that's the whole discussion about the protocols we use. I mean, anybody having them removed cannot have them removed without the protocols. If they do, they could get sick. And I've had a couple of patients that were really sick from that.
Really?
I mean, if they're in a situation where, like, I'd like to think of all this stuff as, that your cup's just overflowing. Like you guys like to say what? Vessel, your
vessel, your being.
So you get just so many toxins and so many things, and you're up to here, and it might bring you over because you will ingest. I mean, it's the vapor, really. It's probably not the ingestion of it, but you have to have all these things take in consideration, the vapor or the particles. So what happens is when you drill, you heat it, there's a vapor. Now, this is the thing that really is not told. This is why. Because when you cut a filling, the mercury comes off. What sublimation is. Like I like if you put your jeans outside in the ice, it would just go from a solid to a gas. It would never melt. So there is solid to a gas in terms of mercury. But when you cut it, it's even more. It's like 3,000 micrograms per cubic meter around you. So that whole thing has to be taken care of. So, I'm training a new person. She's awesome. She's learning how you have to have the suction on the right place. You have to have a rubber dam and isolate. We put a blanket over the patient too, and we give them an oxygen supply, and we have our masks on. So it's a kind of a big deal. It's kind of like lead abatement, or asbestos.
Yeah.
So you have to isolate and get rid. You can't breathe it in. That kind of thing.
You have to be very delicate with it.
Yeah. So that's called a revision.
Okay.
And we use the SMART protocol, which is safe amalgam removal technique. That whole thing is taught by the IOMT and the IABDM. And they both teach this safe technique. You have to isolate with a rubber dam. In other words, so there's like a gasket. If that had a mercury filling in it, there would be a gasket of like rubber dam, and then there would be the patient blanket. So you would just see the tooth, no patient.
Yep.
And they'd have oxygen underneath. And then we slowly cut and chunk and try to make it like safe removal.
Yeah.
And then the particles that come off are also off-gassing. Yeah. And we just learned that sort of recently. Dr. Dave Warwick in Canada did a study with his daughter, and they figured out there's a scatter pattern that's like a 22 centimeters. Like they know exactly where the shit's going. Excuse me.
I cuss on this show all the time.
Yeah, I didn't really even do that.
It's all good.
Anyway.
I'm proud of you. You went an hour and a half without cussing yet.
Yeah, that's pretty good. Well, we'll see. We maybe finish off with a splash here. So that whole thing, those particles we actually get out of the office. Like that whole thing we wrap up and get it out of the office.
Yeah. So it is
it's
literally
an environmental hazard.
Yeah,
too,
exactly.
dude.
And if we're putting it in our mouths, like this is insane to me that it's still a thing. So it's interesting though.
So that protocol has to happen that way. Otherwise, you go over the edge is what I was trying to say. Like,
well, this is what I wanted to ask related to that. Like how many dental offices are doing it in that way?
Yeah. I mean, this is
very few, right?
This is the territory that I won't be diplomatic about.
Well, be diplomatic, but you can also be honest. Like how are most.
So this is why the people that control the narratives need to just be honest and have dialogue about it so that more people don't get hurt.
Right.
I mean, honestly, they're still putting it in. So that means someone's going to have to take that out. So it's kind of like we just have to stop. But if that was taught correctly, so we teach smart technique. Like you can go online and learn how to do it yourself, right? If you wanted to learn as a dentist. But the ADA is not like, no one's really, advocating take out safe removal because the powers that be, well, the ADA followed the FDA's guidelines on who should have amalgam or who could have an amalgam, which this is why they always hedge and they hedge and they hedge until it's too late, and then everything's one way. So they hedged and they said, well, if you're going to have a baby, if you're under 8 years old, underage, if you have kidney problems, mental health issues, maybe you shouldn't have an amalgam, right? Those 65% of the population really shouldn't, let's say. That's what their pie graph looked like. Then the ADA adopted that FDA. So you go on the FDA's website if you want to learn about it. It'll show you all the people that can have amalgam, show you all the people that can't. I don't know. Again, looking back at our institutions, I don't know if they're like really working for us. I mean, it doesn't seem like it. But the other thing that happens with mercury that they didn't include is antibiotic resistance. So it imparts antibiotic resistance into a microbe or microbes in your gut. So it wants to methylate. I believe this is the mechanism. It wants to methylate, get mercury out of its body. So its microenvironment so it wants to get it out. So it puts a plasmid DNA, whatever you want to say, swaps it out. And then that imparts multiple antibiotic resistance. So really nobody should have an amalgam in their mouth if it imparts that. So anyway, all the information's there. It's people don't choose to use it,
Yeah. And of course this isn't medical advice, but like, I just want to be clear for the audience. Like from my understanding, you can't really just go to any dentist's office and say, hey, I'd like to have my amalgam filling taken out. Yeah.
I think that there are dentists that say if it's working and functioning right, they won't do anything. But if there's a big filling and then they break a cusp, they're going to cut it. And so everybody should know how to do it safely. It's just not taught.
Right. This is my point. So most of them are not doing.
There's a void in
Yeah.
Remember I was saying mandatory CE should be learning how to take the mercury out. Yeah. And maybe do you know that Kennedy or, the HHS has taken it out in the Indian Health Service by 2027, you can't use amalgam fillings.
Interesting.
So this is like, maybe it's a little leverage, we can use because why are they treating one population of people differently?
Yep.
And that's what was happening with Medicare and Medicaid. Those kids were getting the Spanish kids or the poor kids, even white poor kids, any poor kid in a Medicare situation was getting an amalgam instead of maybe a composite.
Wow.
So there's like the disparity. Yeah. Like it's like, I might say the V word, but it's like you're going to get the schedule if you're in that Medicare, system,
Medicaid, yep.
But you might not if you have parents that are learning about this stuff, right?
Right.
So,
wow.
So we have to educate everybody.
Yeah.
But unfortunately everyone's so busy with, and 2 jobs and stuff.
Of course. Quick shout out to Podigy, the team that we brought on to produce our podcast. We started working with them last year and the difference was immediate. Way less stress on the back end for us with podcast production, and our YouTube has grown significantly since bringing on Podigy. If you're already running a podcast and looking to boost your production value, or if you're thinking about starting a podcast, I highly recommend working with Podigy. If you check the show notes, there's an assessment that Podigy has put together to give you specific steps to take to grow your own podcast. And that's whether you're just getting started or looking to take your current podcast to the next level. Each month, they're giving away a strategy call with their founder, Justin Moore, And he is incredibly talented and incredibly smart. And he really knows how to grow a podcast from the ground up. So if you're interested in working with Podigy, just head to the show notes and take the assessment. And if you decide to work with them, just mention AlexEc in the way forward, and they'll give you a nice little deal.
I think fluoride was a bait and switch too, like with the studies. Like I read the Fluoride, that book. It read like a novel, like you're in a novel, like it wasn't real. So now we know, like, I guess you could say, does fluoride make hydroxyapatite stronger? The answer might be no, maybe not. We don't even know, but putting it in the water is a big problem. I think now we know that it's neurotoxic, and that there are communities that first of all, countries that don't fluoridate have the same precipitous decrease in caries rate. It looks like viruses too. It looks like all the diseases, because we know how to brush our teeth and we know what to do now. And maybe we have better nutrition. Like, how vitamin A, you're going to get problems if you don't have vitamin A. So we have better nutrition now. And so what happened was, I guess, it's very conspiratorial if you read the novel, if you read the books about fluoride. It was used to isolate. I mean, it goes into the uranium,
Yeah.
It's like crazy, but they used it. It's so reactive, they had to use it to actually to refine uranium. So it's like crazy to think about that. But how did it get in our water? I mean, it may be, I don't even want to talk about it. Like, it's such a weird thing that happened, because it seems like this happens a lot. Like the lead in gasoline was the same thing. The people that are studying it get thrown under the bus. Like the freaking guy said, it's going down. See, I said freaking. Going down into the water, and they knew it was going in the water down a certain amount. They knew that lead was coming off the gasoline, and then they just either bury his research or they discredit him. Or,
right.
Anyway, so the
same thing with fluoride, essentially.
Yeah, and so now, and then it becomes like maybe they're lobbied, like the corporations are lobbying to get it to work. And we don't do fluoride in our office right now. Currently, it's also so ubiquitous because fluoride's in all the water, and then it gets concentrated in all the teas and all the like wine from California is 5 parts per million fluoride. Like, that's not good.
That's wild.
Yeah. So I know too much. I'm like Dr. Debbie Downer here, with.
Well, I've even thought about that when it comes to organic crops, right? Like, what water are they using to water their crops? You know what I mean? Like, are they using a filter? Hopefully they are. But then if they're using a filter, then they're getting the possible, there's so many things downstream.
Well, I wrote a text to my kids one time about, like, I can't do phytates, oxalates, can't drink, I can't eat the food, the glyphosate, I'm just going to eat the air. But then the glyphosate's in the air, you're like.
Right. Quite a conundrum. So can you just share a little bit, like base level education on why fluoride is intended for dental use in the first place? Like what is the reason that it is used?
It maybe theoretically makes the teeth stronger and less resistant to. So I went studied this a little bit more with the K2 sort of thing.
Yeah.
And then what is hydroxyapatite? So enamel is like mostly hydroxyapatite. And then actually, guy who came after Weston Price was Melvin Page. He wrote a book about nutrition. He had really cool ideas about K2 and the calcium it's the calcium to phosphorus ratio in a tooth, and the resistance to acidity. So like we were talking about, it's not only acidity, but if you're at 5.5 on the tooth, you're going to start to go bring this ratio incorrectly into the balance of demineralization. So demineralization is a cavity.
Yeah.
So that's when you were asking about remineralization. You have to start to buffer things. You have to start to build it with hydroxyapatite. Now they have crystals. I mean, there's this school of thought of that. It's like nano stuff. Is that going to hurt us? I mean, so everything, there's probably pros and cons, and we probably don't know totally. But I always say, like, if you can't eat it, if you can't get it through nutrition, you maybe supplement.
Yeah.
If you supplement, it has to be whole foods. So I say all these things, but so fluoride, so maybe it was argued that it was harder, but it may not be as. It's kind of like how lead gets incorporated in the bone. It's not really making it stronger necessarily.
Yeah.
Because hydroxyapatite has this. It's the properties of something if it's all the right environment, so the pH and all that crystalline structure is perfect, right? God made it perfect. But if you deviate from the pH, then things start to happen.
Got it.
Whether maybe it was in the presence of a little more acid, maybe a little more resistant initially, but if you don't have K2, you're going to get cavities anyway. So it's other problems. But then it was supposed to be like the best medicine ever, and it was put in the water.
Yeah, literally put in the water.
One after the other.
Supposedly to help prevent tooth issues, right?
Yeah, now what we think is you hear people say the Nazis used it. You hear all this stuff. I mean, it does calcify the pineal gland because antibiotics with fluoride, fluoroquinolone, and these fluoride compounds can flox people. You ever hear that term?
No.
So it is like calcification of the pineal gland through fluoride.
Wow.
You know how we're being calcified and we're in this material world?
Yes.
Young man, you know all these things.
I don't know all of them.
That's your whole shtick with the whole material world. Well, we're on the material world and we're getting calcified. Yes. And our pineal gland's getting calcified. So is it part of this whole thing? Is it the demons doing it? I mean, they want us to be more calcified.
Physical. Yeah, more physicalized, if you will.
Yeah. I mean, it's kind of wild thinking this way as a dentist. I mean, spirituality, I tell people not to be Lyme, and I start to feel now, I'm feeling the energy around them, like stuff like that.
Wow.
With these people now, I don't know, I'm getting into more esoteric reading that you start to think about.
Well, I'd love to hear your thoughts then, since we're on that topic, and I don't necessarily consider this esoteric. Maybe you could say it's been hidden from us and it's sort of on the quote unquote fringe of any form of dentistry, but it was well accepted, well established amongst traditional Chinese medicine, the different meridians related to the teeth. Do you actually factor that approach in? Let's say, for example, someone has a very problem, a major problem with a tooth rotting, that's a specific tooth, or a tooth has been extracted in that spot. Do you then ask them right away if they have issues related to whatever tradition?
I haven't put that into I had one lecture on that stuff. There's a guy from Uruguay. I know I remember because he's bragged about their soccer team a couple of times. How they won. But anyway, he talks about family stuff, like mom and dad, and kind of
interesting.
But I don't know how he came up. I don't know. It's like foot bath.
You don't know what lineage it came from.
Yeah, foot bath. Does that work, or is it just the wires? I mean, I don't know.
Yeah.
What's the science behind your mom? Didn't love you or whatever.
No,
I don't know.
It's interesting because when I was interviewing Inoa, who helps people correct their eyesight naturally.
Did you ask her about your tooth?
No, I didn't ask her. I don't think I did. Reese, did I ask her about my teeth? No, I didn't ask her about my teeth. I talked to her about my eyes though, because I have, again, problems with this eye specifically. And it's funny because it's on the same side as this tooth. I know that's related to my gut, but this eye issues related to it, astigmatism, I think. I don't remember exactly what she said, Reese, but I think it was specifically related to my mom. We found out.
That's interesting.
I was,
I have to look at the mold. I mean, I could probably Google it, from that guy. It's not it is really wonderful that you get exposure to these things that are really something. That's what I like about keeping an open net. It's I didn't know natto was a good source of vitamin K2. And, even though I knew what Allison was in high school in garlic, so you just keep opening the doors of different ideas. But I think it's cool to talk about psychological problems also. And I tell people, I'm going to be working around, a very sensitive area. And I try to ask them about if they've been assaulted ever. I don't say it that way. Usually I say, I know this are you okay? Are you sensitive for any reason? Anything in the past? I mean, I think it's important. And then I don't think about it that much later, but I tell them I always know that there's something there. Mm-hmm. And I try to acknowledge that. Yeah, because, I mean, you know any number of things that could happen, right? So, so I don't know how it interplays with familial things, but your immune system's definitely affected by those traumas and things.
For sure.
So, but right side, dad molar, mom molar, I don't know. I mean, it's cool to think about that, but I don't know.
Well, you knew right away that this was my gut line. I'm like, oh, wow.
That's because the meridians have been established for thousands of years. Yeah.
That's wild. What is your opinion on wisdom teeth extraction?
That's another sort of slipping into a an undernourished state for a long period of time.
Right. So where our palates are becoming less and less of an expanded
Weston
state.
Price realized that was happening. We talked about that. I would say it's just, I say it's like it's like not malnourishment, but it's like, Casey and Callie Means wrote a book, Good Eats or whatever the name was, name of the book. But they were saying like 2,500 pounds of food is consumed by, each year, let's say 25 pounds, 224,000 pounds, whatever it is, 22,500 pounds. Let's say that's the standard American diet. You're going to be missing the boat on nutrition, right?
Yeah. So
you do that every year. What are you going to grow with? So growth and development is really dependent on a lot of things, but I mean, just, collagen alone is 65% of our body. It's in teeth and bone. Bone is 40% collagen. So that's vitamin C and some amino acids we need. Like nutrition becomes so important. And it's a chicken and the egg thing. Because as you don't breathe well through your nose, like children don't breathe well, they don't grow well because their growth hormones released at night, supposedly. That's what I learned over time. So you have like inadequate airways, and that's a self-fulfilling thing too. You just keep mouth breathing, tonsils get bigger, gets worse, food allergies, like all this stuff happens. It's a nightmare. And did you read Breathe? I'm sure you read Breathe.
No, my younger brother did. He has told me to read it so many times.
Yeah. Well, one thing
he's very big about like keeping his tongue on the roof of his mouth while he breathes and only breathing.
Well, I'll just illustrate this because he did an experiment where he had someone surgically block his nose. I think it was 2 weeks, and he was like, it was the worst 2 weeks of his life because he just started to. I mean, like they marked his oxygen status and all the biomarkers. It was, you get cortisol level going up, hypertension happening. Like within 2 weeks, he had symptoms of hypertension. Like it's crazy, but that's one sign or symptom that most dentists don't recognize. Like if they don't see bruxism and they don't talk about airway, they're missing the boat on even systemic problems like hypertension. So like if someone's on a medication, I'll say, if you ever have a change in your medication or you get on another one, we need to look at your airway. Or like I say, let's look at your airway, usually right away. But sometimes it's subtle. You might have a skinny guy like me who has an airway, issue. So what
are the symptoms you typically notice related to airway, like that point to airway issues?
Well, for kids, like, what it's like when you don't sleep.
Yeah.
The kids act different when their siblings won't. They won't get along with their siblings, maybe. They'll be short. But if they pop out of bed and they're happy, they're usually sleeping well. They're breathing through their nose. So adults are daytime somnolence, daytime sleepiness. I mean, it does have to do with the size of the neck because it is usually obstructive sleep apnea, airway problems. So it's not only the skeletal thing. The skeletal airway is smaller. It's like the adipose tissue and the soft tissue. Like there's 3 fat pads on the back of the tongue, and there's like fat pads on the cheek, so everything gets constricted. I mean, this is the sad thing is like these, chubby kids, how do you say it? Fat kids, I don't want to say it. Diabetic kids, like they're going to be the challenge of having an adult male who has sleep apnea. So it's going to be obstructive sleep apnea on top of whatever else they have with the airway. I mean, it's epidemic. We don't talk about that enough, actually. That everybody should know it's kind of like a stroke. You should know the signs and symptoms of a stroke. You should, everyone should know, grandpa's got sleep apnea and he's going to be irritable in the morning and, whatever. But blood pressure goes up because it's a stress event. It's chronic hypoxia. And chronic hypoxia is kind of what we deal with in these, like around root canals and places in the jaw that you talked about, the wisdom teeth. I mean, that was your original question, wasn't it?
That's all right.
We tangentialize again.
Well, I mean, it all relates,
there's not enough room for the wisdom teeth is kind of what we were going to go back to.
Yeah.
There's not enough room. Like if you look at, when I asked you about Breathe, in the book, they look at skeletons, and you could have another tooth behind your wisdom tooth, believe it or not. And I know you have all your wisdom teeth.
Yeah, I had all mine.
I had all mine, but I was biting my cheek and I wasn't awake yet. I got mine out. I shouldn't have, but I did. All my kids have their wisdom teeth. It's cool. But there was enough room actually behind for another tooth. So we have 32 teeth. You could have had another 4 in there. And other primates have more room. You've seen the mandibles of other primates. And so Yeah, there's a lot of cool things to talk about with the airway, but it's increase in hypertension. Like if I told you about the signs and symptoms of bruxism, grinding. If someone is heavy, you can usually ask the spouse, like they snore.
Yeah.
Usually like there's a funny joke we say like sore ribs on the spouse is sore ribs, because. But usually it's positional. A lot of times it's on their back. So people put a tennis ball on their shirt and then they, try to be on one side. We try to, if we diagnose it without like a medical test, which is read by sleep doctors, if we diagnose it, we make a snore guard, and they have been compared to CPAP. So like snore guard can be compared to a CPAP.
Is that just something you wear in your mouth?
Yeah. So it's like 2 night guards and it advances your mandible forward a little bit.
Oh, okay.
Like that.
Got it.
So you have more airway. Like if you're on your back, you could try it, move your mandible forward to the ceiling and you'll feel more air coming through.
It's wild, the connection between forward head posture, recessed jawline, and like a variety of other health related issues.
Yeah. We've studied this so much. There's a Cregan, Michael Cregan, or there's a video that'll make you cry, man. It's like the kid he had airway problems, and it created a whole series of problems for him, and, but you correct the airway, you correct a lot of behavioral. So like if you look at, we have a chart, it shows like, this is why pediatric dentists need to know about airway, because it's ADHD.
Yep.
All this stuff. So allergies, food, so it's all that stuff and we have to address. And it goes back to food. That's why I love the Kennedy stuff they're talking about. At least, get off the standard American diet for these kids, and then maybe their airways will be better and that kind of stuff.
I also think it'll be like a generational thing though too, because
it is generational.
Some people say that there's indication that whether you want to call it like an adaptation or quote unquote evolution, which I tend not to be like an evolution sort of Darwin related guy, but that there seems to be some sort of negative adaptation happening amongst humans in Western cultures where generation after generation are being born with even like born that way almost, like born with smaller palates and things like this. What do you do?
I think it could be epigenetic stuff that we're talking about.
Yeah. That's
because it is like things are turned on and then they could be passed through the next line. I mean, there's a woman who studied Mercury with like planarians, and then another worm, Egelin worm. I forget what the name of the worm is, but they knew the DNA and everything. They could see mutations happening with the presence of Mercury. So we're, we don't know. It could be just this toxic soup we're all in,
Right. Yeah. This sort of lifestyle, modern lifestyle that we've created, modern landscape. So question related to airway correction. Are you of the mindset that in some cases it's necessary to quite literally put an expander on the top of kids' palates in order to expand their airways?
You can see they're inadequate usually right away. And you see tissue ties, which we laser those.
Are you talking about
tongue ties?
Like tongue ties?
Yeah, you can see
ties.
all these things just locking them down, in so many ways. And the tongue, if it's locked down,
we had revisions on 2 of our kids.
Oh, cool.
Related to the ties.
Yeah,
and it helped instantaneously.
Yeah, right.
Like with my daughter, she had a tongue tie, I believe, maybe a lip tie as well, and she was just not latching properly. Breastfeeding, and then it was super painful for my wife. And then the moment we had those revised, which is really quick, easy
it's awesome
procedure.
Story. Yeah, you should tell that story all the time to friends. And people.
She was immediately able to like breastfeed really easily.
I don't know. It could be growth and development wise, like a cleft is a good example. If things aren't finished, like maybe that's what could happen, where even in utero, all the things aren't going to the full extent.
Yeah.
And then there's a deficit, because the cleft palate is really just not one of them not closing and resealing.
Do you think that same applies for the ties as well?
Well, I'm speaking out loud, like speculating. I don't know if I read anything about that, but I'm just thinking about why would everything be not, so if you continue to advance, then things might go up and, maybe it would naturally die back. Like we had tails, we don't have a tail anymore.
Right.
Like things just get pruned back, as the growth and development of because when you stretch things, you can have people just pushing things.
Well, I know a guy right now for adults, and he's had some incredible results. I'll have to send you his page. His name's Oscar Patel.
I've seen him.
That is like the
He's
results.
Cool.
Yeah, he is super cool. I reached out to him probably 20 times now to try to get him on this show. He's just not interested. It's okay.
That's okay.
He originally said he was, but then he stopped responding. But I want to interview him so badly because the results that he's getting.
You can do off the record stuff, and if people want to publish later or something.
Maybe. But the results that he's getting with adults, because the idea, from my understanding amongst modern orthodontics and dentistry, is that once those sutures
that's not true.
I know, but that's what they think.
No, that's what they think. Yeah.
That's
another misnomer. Honestly, that's why we need to have dialogue. You're talking about, you can move sutures in like a 70-year-old.
Yeah.
So you don't, there's just maybe one or two that lock down pretty tight.
Yeah.
But yeah, I mean.
What we're referring to, by the way, for the people who may not have caught on to that, is that there's this idea that most dentists and orthodontics have come to accept, which is false, that the sutures in like the upper part of your palate fully form to where you could not have any shifts and expand your palate naturally without any hardcore intervention. And it's not true. Like, again, Oscar Patel, with the results that he's getting with his people, is proving that this is complete nonsense time and time again.
Yeah. I mean, if you pushed, on this bone long enough, you'll get a dent in it. So things move. Yeah. And so I guess what you were asking about with kids, as soon as you identify an adult or a child, there's a more sophisticated way to do with appliances an adult, and it's called DNA. It's like very cool idea about moving things slowly and adjusting and making sure simultaneously the mandible and the maxilla, upper and lower jaw, are kind of moved at the same time. And you're advancing the palatal, like the palate here on this section, that's just this little wedge. And that's what you're talking about, the sutures. So this little wedge comes out and you have a little bit of space behind your canines, but you're opening that airway up. But as soon as we know kids we try to talk about daytime or nighttime appliance where it blocks them from breathing. But if they're like really sinusy and sticky and all that, we have ones with little vents, a little bit of vents, so they start to learn where to put the tongue. And then when they start to put the tongue in the correct place, it does expand. So people have like tongue thrusts, they'll have their teeth are coming out all the time and you'll see an open bite. So we can see it, recognize it. And the bruxism happens with kids too. I don't know if any of your kids grind their teeth.
My daughter does a little bit.
So her airway is you can just say right now, she's probably crowded.
She is. Yeah, we've already had that verified. My son, his is not, my oldest is not crowded. Hers is very crowded. And she was the one who had the severe lip and tongue ties. Yeah. It's interesting.
So you introduce like in adults, the SnoreGuard, and kids, like it's called a habit corrector. I don't want to mention names, but there are different companies. There's an Australian company. There's companies that have silicone, like kind of safe materials that can be used at night where the component of grinding gets eliminated. It also like guides the teeth into one place and lets naturally happen when you're locked in. So expanding the maxilla, expanding the palate right away opens up the mandible to go down and forward, which it wants to do. So like what happens is if you see like the Beavis and Butthead sort of cranked up kids, like they're just like way back and that they're going to be not breathing as well, not doing as well in school, like literally.
It's wild though, because looking at her, she doesn't have like any recessed jaw or anything like that, like lower jaw.
But it can be just everything being a little bit smaller.
Yeah. She's just kind of petite and tiny as she is. Yeah. It's interesting. So
just
in that
get her
case,
raw milk.
That's what we've been trying to do, is get her to drink a little bit more raw milk. She's like, for whatever reason, she is not a fan, but we're trying to sneak it in multiple ways. We've had multiple people recommend that. So for, you, as you see me here, by the way, for those who are listening, I have a glass of raw milk on the table that I've been drinking this whole time. So for kids who do have a narrow palate, what do you typically recommend? Like, what is your
Well, we'll say early intervention with ortho, meaning like get the palate opened up.
Yeah.
I try to do everything without taking out any teeth, because a lot of people will. Now that's another thing, not to step on people's toes again. Conventional ortho, sometimes they'll just take the bicuspids out and then they'll bring everything together, which impacts the airway again. But we just try to teach, like, once you get that upper arch better, and you get the two jaws separated at night, I say, like, we're going to separate you two so that you can grow down and out like that mandible's supposed to grow. And then once it grows, the other thing that happens when you clench is you lock down your molars and they start to tip in, and that where the tongue is. So the lower molars start to tip in. So once you expand the palate appropriately, orthodontists are great at doing like early intervention. They know how to do that. So if you try to get it done that way, then they won't want to do extractions later. But some kids have to have the extractions to make it easier, but also potentially because you might have soft tissue problem and bone problems if you advance the teeth too much. So it is tricky.
How do you teach a 5-year-old though, my daughter, for example, to like breathe with her tongue on the roof of her mouth?
An appliance that we introduce at 5 teaches them. It has like two little pins or little projections, and you have to feel that with the tip of your tongue. And if you feel it with the tip of your tongue and you swallow, it goes up.
Got it.
So
you just keep that appliance on the roof of their mouth?
Yeah. So no, the appliance is the whole mouth.
Oh, okay. Gotcha.
It has a section for both upper and lower jaws.
Got it.
And then it has a little tab to teach you how to swallow. But it also has a little flange, like helping advance the palate this way. Because when you don't, if you're not locked together, the lower jaw, those molars are all upright, and then your tongue will have a place to park.
Yeah.
So like that whole thing has to happen all at the same time.
Well, that's what I was wondering. Like even with what Oscar Patel teaches with respect to thumb pulling, isn't that only
he's doing palatal. I mean, doesn't he do stuff like this too on the lower?
Yeah, he's doing a lot of stuff.
You're like simultaneously moving everything.
Right. Okay. That's what I was going to ask, is because there's some people who only advocate for thumb pulling, but I'd imagine that's only expanding the upper palate, and that's not addressing.
But naturally, the lower will probably come up.
Because
the tongue is in there pushing that way too.
Okay.
But if you're clenching and grinding, you lock it down, and then so it doesn't move.
So even if you do only address the upper palate, it still will have an effect on the lower palate as a byproduct. That makes sense. Well, it also makes sense because the lower jaw is literally ultimately connected in the upper jaw. So if you expand the upper palate, it would widen that point, I'd imagine.
Theoretically, at that posterior part, you're probably not expanding that much.
Okay. Yeah. Gotcha.
But the mid face does change so much. Like this part, the lower. The mid face is what we have in our standard American diet, giving us that crunch.
Yeah.
And then that dictates the lower. So it becomes the third lower part of the face.
Interesting.
But you can see it in profiles a lot. But like you were saying, your daughter has a reasonable profile.
Yeah, she does.
It's just her tongue is probably just a little bit too big, because that's probably more predetermined than nutritionally, the jaw.
Do you look at whether people have mapped tongue or not?
Sometimes I look at that. I mean, usually there's GI issues with some of the reflux. You see reflux. Oh, that's the other symptom, reflux with adult sleep apnea patients will have reflux, and then they'll be on hypertensive medication. So they'll be like, they're having to fool around with their sleep sometimes because, but it's tricky. Not getting oxygenated on a regular basis is bad. It's bad.
Yeah, very bad, of course. What is your opinion? I'm just going to keep rattling off questions if that's okay.
I like it. We'll do the rapid fire section now, Reese.
What is your opinion of, this is a very general question, orthodontics? Because I'll just put it like this. I've heard that the train track braces are actually in the long term problematic for airway health and like palate related health, because like your palate was intended to not have permanence. I don't know if that's an appropriate word.
There's like dynamic. You're saying there's things are dynamic.
Dynamic. Yeah.
Well, I would say that when you start to look at what they call functional orthodontics, like if you're not just making aesthetics, like I'm going to make your smile perfect for your face, might not be the right way to have it. So, but I think the materials can be an issue for some people. The nickel titanium. I do like some of the Invisalign. They're doing slow, moving the arches. Then you can still water pick and hydrofloss and stuff. But I think the question is whether you're overdoing it expansion-wise for the skull, for that size person, and whether it's exceeding the limits of like even the gingiva and the bone here. Like if you expand too much, you're gonna get recession on the outside. And, the stresses that ortho puts on teeth is kind of like moving a tooth, is like we were talking about. The ligament is stretching, and then you kind of move a tooth that way because you're directing it to go there. And then there's rebound because it wasn't there before. Some of the early techniques that we're using, like early intervention, it just moves the teeth and they come into place in the right place because you're naturally having them happen. I mean,
you look at all the people that Dr. Weston A. looked at, they weren't using braces and they had perfectly formed palates and teeth.
And it's, again, I mean, mostly comes back to food again. Everything comes back to what you put in your pie hole,
Yeah. That's so interesting. So for me, I had a permanent retainer and it came out, and then immediately my teeth have started shifting over the last 2 years since it fell out.
Yeah, I have a sort of similar situation there. But yeah, I mean, teeth do move. There's dynamic nature of teeth, and there's weird things that happen when a tooth's not vital against another tooth, an implant next to another tooth, a lot of different stressors and things that can happen with that. So rapid fire, come on, let's.
Yeah, what is your opinion of veneers?
Veneers are a quick, answer to making something aesthetic. If you can do something with braces and move teeth in the right position, I'd rather do that sort of thing.
Well, this is what I had.
And then stripping, it is a cosmetic thing where you're bonding. I love Del Bigtree. He probably had veneers.
I'm pretty sure he did.
Yeah. So I watched him when he was doing the doctor show, and I love Del. I'm a contributor. So, and I'm going to visit. I think I'm visiting there tomorrow on Tuesday.
Okay.
Yeah. So, but anyway, that's a case where, aesthetically, maybe they couldn't do the braces right. And his vertical dimension looks better. He looks like he has better airway. So through that mechanism, they're probably crowns.
Yeah.
But veneers, you're just you can do it with little, be kind of conservative and just bond it but you're still bonding something to the enamel, but you usually just do a fine strip. You can keep them clean, and their materials are probably pretty safe. So if you had to go that way, it depends on, I look at my teeth, I'm like, am I ever going to do that? I might. I'm going to be 60 in 2 weeks.
You look great.
Thanks. But I'm getting long in the tooth some places, that whole expression. And I don't have periodontal disease, but it does happen. And I think my orthodontist brought my teeth out too far. And so I'm experiencing sort of that recession that happens with that.
Most healthcare today operates on an outdated mechanistic model, treating the body like a battlefield rather than a self-healing system. You wait months for an appointment only to receive a rush diagnosis that labels you rather than truly understanding your unique health. Even in holistic health, many practitioners rely on endless lab tests and supplement protocols, addressing symptoms instead of the root cause. And the result? Another prescription or supplement regimen that merely suppresses or masks symptoms rather than facilitating true healing, whether the imbalance was physical, emotional, energetic, or a mix of all three. And that's why Dr. Tom Cowan co-founded the New Biology Clinic, to offer something radically different. As one of the most respected natural health doctors in the world, Dr. Cowan has spent decades challenging conventional medicine and advancing a deeper understanding of human biology, water, and natural health. His work isn't just about rejecting the mainstream, it's about offering a more truthful, biologically coherent approach for healing. The New Biology Clinic recognizes that health isn't about fighting disease, it's about restoring balance. You're not a diagnosis, you're an individual with a unique story, and healing should honor that. With virtual consultations available worldwide, the clinic offers a flat-rate monthly membership that gives you direct access to practitioners who take the time to actually listen. Members also get exclusive health live streams, a resource library, and live sessions covering everything from biofield tuning and breathwork to movement and meditation, all designed to support whole body healing. And if you're not ready for a membership, you can book a one-time appointment, sign up for an enrichment-only membership for the healing modalities alone, or schedule a free connection session with one of the care team members to see how the New Biology Clinic can help in your specific situation. This isn't about keeping you dependent on doctors. It's about making you sovereign over your health. Head to newbiologyclinic.com and use code THEWAYFORWARD, and that's spelled The Way, F-O-R-W-A-R-D, for $50 off account activation, or just head to the show notes for more info. If you're a member of The Way Forward, email hello@thewayforward.com for $150 off. Your body already knows how to heal. and New Biology Clinic helps you remember.
Yeah, for me, what is really frustrating, again, this tooth, like I said, is half fake, which you picked up on, which is still so wild to me. But I chipped it in 5th grade, again, basketball. And I've just had composite put on top.
Yeah, so you could get a veneer or...
Well, I don't want one. Like for me...
Well, there is the idea of the tooth breathing. You remember I was talking about the fluid flow?
Yeah.
So a veneer on the face is not as bad as like the whole tooth.
Yeah.
In my mind. I mean, I do crowns that have to be done. And sometimes I'll do what it protects the cusp and it comes down, but it maybe doesn't go all the way down to the gum.
Got it.
So you kind of let the tooth breathe still, like fluid flow. So there's that whole thing, which we don't have a lot of studies on that, honestly. I mean, could be one of those iatrogenic problems that we can have.
Yeah, it was just something about the dentist that I was seeing. This was when I was in the military, said, we're going to file the rest of this tooth down and then put like either a crown or a veneer over top. And I was just like, no, I don't want to do that. I want to keep as much of this healthy tooth, quote unquote, as I can.
You're in the public, so you might want to consider, aesthetically if it got darker. Because
it already has.
Yeah, because teeth will get darker and darker. That's not a root canal though?
No, this is not a root canal. It's just this part right here is half fake. And I can tell the color difference. And if people look long enough, it's discolored on the fake part where it's darker than the rest of my teeth.
So you can do that easily with composites and they look nice. It works out. It's amazing what you could do with a little art project like that, quickly. So
do you do that? Okay. Well, when I figure out this tooth or lack of tooth in this, I'll come do all that at the same time. Not to make this an Alexac case study, but this is also another dental related thing that people have issues with. I have
there you go.
Very bad TMJ. And if I
Does it hurt though?
It doesn't hurt at all, actually. Well, I still play pickup basketball and I play sports every so often. And if I get hit slightly in the wrong way, it'll be like 1 to 2 days where I'm struggling to fully open my mouth. And I also noticed though that if I chew on the left side of my mouth, then I have the sound happen and my wife absolutely hates it.
Can I dance to that?
I can make a beat for you. If I chew on the right side of my mouth though, I'm missing this freaking tooth. So like,
well, balance, we talk about harmony of the joint, the muscles in the teeth. I mean, it really a discrepancy somewhere. Mm-hmm. Sometimes it could just be a matter of like occlusal adjustments on cusps. Well, because if you have trauma and you, let's say it was swollen for a little bit.
Yeah.
And then you can adapt to that inappropriately, So condyle, they have a condyle.
What is a condyle?
The condyle is the end of the mandible, that you see that, you see a mandible like this that has a piece that comes up and the condyles here, there's a disc that sits on top and it's kind of like the only other place is a clavicle that rotates anywhere you want. That's the other place. It has 2 concavities on the side and it sits on, but the click is it popping out on a medial pole, which is on the inside. So it recaptures the disc. If you can imagine, it goes, but if it went completely off and you might have an open lock. You ever hear that? Open lock?
I've had that before.
So this is for people that get open locks. You have to go down and out and recapture the disc.
I've had that before.
It's pain. That could be painful.
No, it's super painful. And it's also because when I was I don't want to say moronic because I don't want to speak ill of myself, but when I was a middle schooler, I discovered that I could pop my jaw to place if I wanted to. And I would do that as like a trick to show people. Yeah.
So you might have Dana Carvey, when he was doing the characters like this, he actually had TMJ problem after that movie because he was like moving his jaw. So really it's, we're so adaptable. I mean, that's what it is, but you probably injured it the time when you got hit.
Yep.
And I mean, I know people, we flood ozone into the ear and just getting new oxygen in there, maybe the stem cell, rejuvenation. I'm looking at hyperbaric oxygen. That's my next road. I'd love to see if I can have something like that someday because we deal with osteonecrosis of the jaw, which is what these cavitations are, and getting oxygen into a place like that. So this is really very, very well, not very well, vascularized either. There's synovial fluid there. and it sits there in a capsule that's kind of isolated too. So I've put ozone like over the top. I haven't gone in like they do when they lavage the whole thing, but you can, like, it gets drawn in just by going sub-Q. But if you put it in your ears and you just let it flood, I'm like playing around with that myself, with moving my jaw around. And like, if you were at my office, I would say just, you can rotate. Like, you shouldn't open your mouth that big anyway. Right. Like, that should be a no-no for you if your wife's accurate in that regard. So if you rotate your jaw, you keep your tongue in the roof of your mouth, and that just rotates on the condyle. But if you go for like a giant sandwich, then you translate, and it comes down the eminence of the skull and drops down. That's where the disc could pop off.
Got it.
So it's like, you don't want to do that. And we try to be careful about that with patients who have problems. Anyway, the temporomandibular joint is TMJ. So if you have TMJ, everybody has TMJ because they have a temporomandibular joint. But when you're referring to as pain, that's why I asked about pain.
Yeah.
So you either have pain or you have popping and clicking, but no pain. It's like, you're not really a TMJ patient. You just have noise. And that could be just...
Well, my wife wants me to be considered as one just because she hates the sound so much.
Well, you do it when you're eating?
Well, like it's really chewy.
Did you say your wife doesn't like people eating?
No, she doesn't like chewing. She definitely does. She has misophonia.
Because it double then if it's clicking and chewing. I mean, there's a double problem there.
If I'm eating something that's really chewy, it will like make that sound. Not as audible as that, but it will make the sound.
So you got popular making that sound?
I mean, I got popular, quote unquote, when I was in middle school by popping my jaw out of place because I was like, oh,
there was a guy in my 7th grade class who could bring up a hot dog. Like, he would bite a hot dog and bring it right back up.
What?
Yeah, that was his game trick. Ew. That was his stupid pet trick there.
That was mine. Mine was the freaking popping my jaw out of place. Are you saying that like it's technically not natural or appropriate to open our mouth that wide?
Well, I was saying it could be, it's kind of like if you took a chicken leg and brought it past its range of motion, something like that. It probably is within the range of motion because we can do it.
Yeah.
It's kind of like a snake swallowing something.
Got it.
But we don't disarticulate it. We shouldn't disarticulate it. But it's advancing down to a point where it stops. So there's this small amount on the base of the skull. So maybe you're going a little bit too far on that. Yeah.
Okay.
Just for a joke,
That makes sense. Well, I don't do it anymore. No way. No way. Okay. Here's something I've thought about when it comes to Dr. Weston A. Price's work. When he was looking at these civilizations across the earth, were they brushing their teeth? Oh, yeah,
that's a good question. Yeah. Well, I think he saw that they had different devices like reeds and things. So they were removing plaque, but because they didn't have sugar, the plaque was good schmutz, not bad schmutz. So, but I think he found cultures that had different, like even, a good sourdough, oatmeal, and it's going to clean teeth. So food does clean your teeth in a way. Teeth are designed to incise, cut, and then put it back. And then when you're chewing and masticating, I didn't say a bad word, masticating, and the first molars are kind of like where the predominant chewing is. Your tongue throws the food back over on the top, and that food, that motion, you're crushing the food, all that. That's all appropriate like stuff, that's supposed to happen.
Got it.
And I don't know what the question was, but if you bite too hard and you're making
it's about brushing teeth specifically.
Oh, yeah. The food cleanses teeth because it's made so the embrasures, the plaque actually gets wiped off sort of with the right diet, with harder structures that we talk about. That's probably what he noticed the most is texture, chewing and how long people were eating. In that book I referred to earlier, he was talking about chewing. Like he said, we need to chew. He was having them chew gum. So I don't know if they were mad because he was chewing gum or if he was saying food was soft because he said the food is soft. That was in 22. So like maybe the food was already getting like kind of that way. And so we weren't chewing, masticating appropriately where the forces are adequate to stimulate the bone, stimulate the joint, stimulate everything. We don't know. Who knows what's happening there? A lot of stuff we don't understand, right?
Yeah,
that's happening. But they didn't brush their teeth, but they didn't have the plaque that was negative. I'm sure they did at some point where sometimes an injury might have, like their form of basketball, boom, and you have a split tooth, because there are skulls that we see with abscesses and stuff. So it does happen, from trauma, mostly probably. When the modern foods came in, he saw even like locationally, geographically, like at the ports, that's where they got the Coca-Cola or whatever it was. And then going up into the mountains, that's where he saw the difference. So like, it was kind of cool. And it was before as much transit we have and everybody moving around the world in the 30s. Like
people were more isolated back then.
They had prop planes. I don't think they had jet engine.
But the point is people were more isolated. So you actually had a good sample of people who were not a part of Western, quote unquote, modern culture.
Yeah. Sally interviewed someone who went out like in the middle, some islands out in the Pacific where they're using shells for like currency. And like the girl had to go from one place to another and hike up into this, it could be one of the last isolated populations. It's so beautiful.
That's so cool.
Yeah.
Okay. I want to talk about remineralizing teeth and sort of building back enamel naturally, and your thoughts on that.
Yeah. So you have to stop doing certain things and start doing other things. I mean, it's common sense based on the conversation. If people are still listening to this,
they're listening.
They're still listening. Thanks for listening. No, like it is removing the stuff that we talked about, acidic, sugar, and foods like
you
the soft
specific foods like that you typically see are problematic to maybe
things that hang out, are going to be a problem. Like actually I was watching the Australian, I was looking at the Australian plate, and they had a lot of carbs. Like they had a quarter of carbs, crackers. That's all refined flour, and it tends to have like a sugar effect, right? Because it's so
it converts into sugar.
Yeah, it's converted. Yeah. So like you have to change your diet. You can't snack every 10 seconds, right? That's what a lot of people do. You have to do a bunch of things. And in that book also, they talk about vigorous water. So I think that they must have taught, like maybe these cultures knew how to rinse their mouths out with water. So it's the food was better, the water, maybe they learned how to do that. If they didn't have toothpaste, toothbrushes, they had maybe devices, and they also probably learned how to rinse their mouth out correctly. Like they were taught that, as like their moms probably said, you have to do this, this, and this. And, but like you have to stop eating the crap, drinking the crap. Honestly, smoking interferes with the microbiome too. And I mean, there's so many different drinks now that we don't know what it does, like the preservatives, the chemicals. It's not just acidity. So you have to stop probably eating modern made food like Weston Price talked about, just right. the commerce, I can't believe how many, you go into Sheetz or a place, like how many drinks there are. I'm like, it's unbelievable.
It's wild that you go into the grocery store these days and most of the stuff that is there, like the overwhelming majority of the stuff is not actually food. If you think about it,
I can go in and like, I would buy Slim Jims, pickles, and water. That's like the only thing I could come out with, really.
Yeah, it's insane.
What else is there? I mean, pretty much everything is highly processed or highly processed. So you eliminate that junk foods and stuff and candy and really all those things. I mean, the other thing that's crazy is all the creamers. I mean, they have a whole section now at like our supermarket with hazelnut, this, that, and they're all high fructose corn syrup in there. So it's just disaster. But anyway, that has to be eliminated. So those are the stops. And then and if you're not eating the right foods, like if you don't put ghee on your plate, and cook your egg and ghee, raw butter. If you're not eating those foods that are conducive to the buffering capacity, like cheeses are great. We wanted to talk about that earlier, but anyway, I don't know. They didn't brush their teeth. So they did have like fermented foods coming into the mouth too. Like if that's what they were doing, that's also a way. I have an article on how they mitigate, like bringing those foods in, like the terrain guys talk about those bugs coming in will mitigate, like the acid that they make isn't the acid that you get from a pH of phosphate, that's in soda. Mm-hmm. So it's not the same acids, There are acids that modulate, like the strep mutans that cause decay, and there's acids that do other things. So they all work together. So, but I would say if you hear the story over and over, people going paleo, like going just carnivore, they stop their gums. My gums used to bleed. I mean, we heard it on our calls a couple times. So, I mean, it does happen all the time. We heard it on the call a couple times, but that idea of changing, having all the stops, then you can return to normal, like homeostatic species in the mouth. And and the other thing is like insulin resistance and like all the other things that come with that.
Because when leptin sensitivity, like light environment relates to it as well.
All of it. Yeah.
Because like I've heard you say in other contexts that the amount of sunlight you're receiving is incredibly important too with respect to dental health.
Yeah. I mean, vitamin D conversion is on the skin, but now we're learning it's like we're maybe producing energy through melanin. You know, I always thought that when I was a kid. That's the stuff you guys talk about. It's like you always knew intuitively, like that you were a plant. Yeah. I was like, yes, I am a plant. Thank you.
Yeah. I get like nourishment from the sun.
Yeah, I'm like a swim plant, like some kind of like kelp, I guess I am. But
you like
because I like all my sports are on underwater, like sailing, swimming, scuba.
It's probably something to that. It's probably like a charge related issue or like some form of, I don't know, like you're receiving an abundance of negative charge from the water that is beneficial to the fourth phase water of your body. I don't know. There's so many ways to look at that.
I want to tell you something happened to me that I thought, because you guys think this way, I thought this was beautiful. You probably love this water. It's a water story. So I'm at a funeral for my good friend's father, who's a dentist. And so we went to visit her at their church in Pittsburgh. And a cardinal, like I'm standing waiting for her, I was going to hug her, and a cardinal comes up on the tree. I'm like, that's cool. But when we went to the gravesite, there, things were said and people were weeping like from the center out. Like it really literally went through the air, I think. Like I heard words, but I didn't hear everything. But it didn't matter. Like everyone started to cry.
You felt the feeling.
Yeah.
Just like,
so I thought like the tears translated like the structural, I don't know. That's what I just thought in my mind. I don't know if it could be true.
Well, no, it makes sense.
But there's water vapor right now in the air. Now.
That's what I always go back to, right? Like if what Veda Austin's indicating is true about like thought energy impacting the physical orientation of water. And then we know, we can assume that we have an electromagnetic field that surrounds the human body. I'm trying to say I know a lot less, especially after the interview I'm coming off of with Dr. Jordan Grant. Setting that aside, we likely have information being passed through our field, through the ether. And if in that case, for example, you felt the wave of crying happen, it's like the water. I almost
saw it.
Yeah.
I swear, like I heard noses sniffling like around me, like as I was getting that. But I tell people like in my family that it doesn't even ring anything. Like, so I think it's my imagination or something.
No.
And then you like doubt yourself, and
it happens.
It's so intuitive. It seems so real to me. So
it is real. It absolutely is. I
wanted to tell you about that.
That's cool. That's really cool. Wow.
But it could explain why. Like I'm at a lecture, the same thing happened to me. But the woman was talking about scoliosis probably is mercury related. Like most scoliosis is there's no etiology. So it's probably mercury from the mother.
Interesting.
So the baby who has scoliosis. Anyway, she's telling the story about her own daughter because she was mercury. And as soon as she had this little change in the tone, like, you know how Pete always looks at words and stuff, like something there with just tone too. And just how she like maybe got a little, in her voice. And I started crying. There were other people doing the same thing. Wow. She was telling a testimonial, but you didn't really see it as that because she didn't say it was like, she didn't give you all the background, but you knew she got emotional about it. The same wave hit me like there.
That's so interesting.
Yeah. So I feel like that I'm getting that. Like I'll tell patients, oh, you were so calm during this. Like, cause I know they were.
Cause you could feel it.
Yeah.
Yeah. It's so interesting.
But the reverse is happening too. So
yeah, I mean,
I got to get people calm. I got to get people calm because if they're nervous, I get weird.
Do you feel it in your body?
Well, one of my assistants, Olivia, says I get diva. I get a Dr. Diva, like because I get a little tone, and get a little cranky. But I never throw instruments. Thank God. I don't have a temper.
That's good.
Well, I do have a temper, but you
don't take it out. You don't take out the temperature or the temper on your patients. That's good. Is there anything else that you want to cover? I think we've hit like all the stuff that I wanted to hit.
Oh, well, the only other thing I didn't finish saying that I remember is periapical periodontitis is an abscess. So the things that translate from perio that we know cause, increased cancer, increased prostate, problems, lung infections, low birth weight babies, all these things we apply to perio because we know the organisms. There are some just different organisms around an abscess if we see it. And 40% of teeth that have root canals have an abscess on them. But, they claim that they're stable again, that they're not. But that's periapical periodontitis. And by definition, it's changing because a lot of times the bone is changing around it. And there's an osteoimmune system too. So like it may be that they're more intimate with the immune system in these spaces, in these places, than the perio is in a different way that we don't know. We're starting to elucidate that. Dr. Lechner, Hans Lechner is my friend. I went to see him in Munich. And these are all teachers of mine that I value their ideas. And Dr. Baku is a pathologist, and they show the bone and they show the stuff that's there. So it is really like an infection, just like periodontal disease. So it's not difficult to translate these things. Are they good for us to have them? I don't know. I probably don't think so. So, but anyway, I try to be diplomatic about it, but I just say like lay out the physiology, the biochemistry, and you start to say, maybe it's okay. Maybe it's a compromise. Maybe people want to do it. That's fine. But if you have illness and you see things, you have to reverse engineer the cake. You got to rebuild the cake, and with good ingredients that maybe are biocompatible, get the lead out, get the mercury out. Metals, we always want to do metals. We would do root canals after that. And then we look at the wisdom teeth sites after that. But it's just, it is all connected with the nutrition, making sure that's all on board. So the individuals that Weston Price saw all around the world, they had their unique culinary things, but they usually ate head to tail and they're usually eating animal protein. Yeah. And that's
seasonally as well.
Yeah. That's a big problem because vitamin retinoic acid is, you can only get retinol like from a liver, like from an animal that we need. There's a story of Weston Price. There was somebody, he recalls this, it was a person who was like up in Alaska with the Eskimos and went blind. And the story is they took a fish and got the fat behind the eye and fed it to the guy, and he restored his vision. And it doesn't seem so far-fetched now, like that I know all the nutrition stuff, because if you're missing that every time. And the only other thing I wanted to talk about was not to throw big pharma under the bus, but often there's every drug you take, you have free radicals forming in your body. And every drug you take has to be processed through the liver, through detoxification pathways 1 and 2, 3. And, we don't have all the things to deal with that sometimes, but they cause depletions. And that's another thing we don't talk about. Physicians don't talk about. Like a good example is the statins cause CoQ10 deficiencies, take out CoQ10. So now in Europe, they have like CoQ10 with a statin, but most medications cause dry mouth, low magnesium, low B vitamins. So there's these things that happen when you have polypharmacy that's hard to deal with. And the biggest challenge we have, like my hygienists are so beautiful at talking to patients about like dry mouth, xerostomia, and trying to mitigate, the potential is terrible. Like the cavity rates are high, geriatric cavities are usually on the gum line. They're hard to do, anyway, but anyway, that's the only other thing I'm trying to think. We covered a lot of stuff.
We did. We covered a lot.
How long did we talk for?
Probably like almost 3 hours. 2.5, probably 2 hours, 45 minutes. Yeah.
Reese, what do you want to know about Reese?
Yeah, actually good question. Reese, do you have any dental related questions?
Kissing. Reese, do you kiss anybody?
Do you have a boyfriend? Yeah.
Well, kissing, you swap spit, you're getting the bugs from your partner. So dogs, mothers, and lovers. So we think that the worst bacteria we probably got from some kind of wolf dog hybrid that we used to hang out with, maybe 10,000 years ago. But there's a really aggressive bacteria that they've implicated. It's advanced periodontal disease, Alzheimer's, cancer, P. gingivalis, Morris gingivalis.
Interesting.
It's a hard word to say. That's why we say P. gingivalis.
Got it. You did have a question though. What came up? Or did you not?
How to stop lip biting?
Oh, habit. Yeah, habits. That's good. People bite on things. People open packages with their teeth. I mean, you have to be disciplined about
I actually
habits.
chipped my tooth after I chipped it like 6 times by biting a label off of
opening stuff. Yeah.
No, just biting a thing off of a t-shirt, which is ridiculous.
Yeah. So habits are tough. People are, going like this a lot, cheek biting. There's something called linea alba. We can see right away people cheek bite. If it's accentuated, you can see people suck. I don't know how to say, you can, if you're a friend, if you have friends that are doing that, you can point it out, you chew your cheek. I mean, multiple trauma. I got my wisdom teeth out, like I said, because I was chewing my cheek. But it was only because I got caught there over and over and traumatizing something isn't good. And that's a reason why like tobacco's bad. It's traumatizing the tissue so many times that eventually, it wants to do something wrong. So dysplasia is like epithelium that's changed. And so you form, we tell people to put like a sticky note in different places. And if they see the sticky note, oh, I am biting just to remind them. If you have someone who studied like the 4 agreements that could deal with you saying you're biting your cheek, without taking offense to it. But it's like a reminder helps. And I don't know how you catch yourself doing it, but there are other habits like biting on pens and things. You have to just stop. I mean, I don't know how to say to stop, but
bringing yourself back to
the meditation
now,
and now. Yeah,
that's it. Like, just when you're present in the now, naturally your posture becomes a little bit better.
Yeah. So when someone has periodontal disease, maybe one person in the family, and it's a new relationship, you're dealing with the perio and you're trying to change that, you tell people not to kiss. I mean, that's like dog's mother. Dr. Kennedy, he talks about fluoride, and he's been in the academy for years. He says dog mothers and lovers. I'm quoting him. Like, it's a funny thing because, it does bring up that's an interesting thing to ask the terrain theorist guys. But if you introduce an inoculant enough like times, you're probably going to populate that other place.
Yeah, of course, like bacteria can colonize from other places, but will it cause disease? Because we just went over this the other day in the examples where, for example, trying to demonstrate that the pertussis bacteria was the cause of whooping cough. And they either did a series of studies on rhesus macaques or baboons or both. I actually think it was both. And in multiple cases where they took monkeys that they had injected with an absurd amount of fluids from a sick person who had the symptoms of whooping cough and had the pertussis bacteria.
Sounds like a good study to me.
Right. Yeah. Already a good start. Right. And they either inoculated them by pouring an absurd amount of that fluid inside the monkey's lungs or injected it directly into them. Right. And then they had another set of monkeys next to them that were not injected, but they were trying to see if the disease transmitted. Right. Those monkeys who were not directly inoculated, but were just next to the monkeys that did have that bacteria colonize in them, but did not develop symptoms. So then that flies in the face of it being the causative agent.
Well, I think it's kind of like this whole, like if you look at the total population of India representatives, there are these little clusters of individuals, but if you gave them enough time, so if that matures in that person's mouth, but if it gets introduced, but it's not a pathogen that's like it's being dealt with already, that's what I said about balance and homeostasis. So you could have a person with perio maybe not transmit it if this is the right microbiome and it's modulated correctly.
Well, it's just the way that I look at it is there a job for that bacteria to do right now? And
that's true.
If not,
that's why it's called opportunistic. It has the opportunity to do something like you're saying. Yeah.
To do a job. That's a good way to reframe opportunistic. Yeah. It's like does it have an opportunity to do a job? Yeah. That's a good way to look at it.
I just read this morning, like binging cramming for this thing today. No, I was reading a couple of articles, but like yeast do have an important part in the microbiome. Like,
absolutely.
But they also increase in the presence of mercury and they increase in the presence of sugar. So that throws them out of whack. And then maybe they're not doing the things they were doing or supposed to be doing, or it gives the opportunity for some other bug to kind of come in.
Well, this is where I'll send you some stuff on pleomorphism that'll blow your mind that like there is an indication that people, for example, I'll just give a brief example, and I do not claim to be an expert in this, but there is a lot of, I guess, strong correlation related to what I'm about to say. So people who have used a lot of antibiotics in their life and have not done enough to remediate their antibiotic use typically have a lot of quote unquote candida overgrowth. That's what they'll say, right? But it's not that the candida is overgrowing and overtaking them. It's that fungi is a more aggressive bioremediator. So when you do enough of trying to quote unquote kill the bacteria through antibiotic use indiscriminately, obviously, that bacteria will then morph to a more aggressive bioremediator in the form of candida, which is present in your gut. And because it's present at the site, we then assume it's the causative agent.
So it goes into a yeast, forms a yeast.
The bacteria will literally morph into a type.
That I've never read.
Yeah,
I mean, that's pretty cool.
I can't wait for you to look at polymorphism.
I kind of like that idea because of the things we're talking about with innate intelligence with maybe this DNA stuff. I mean, who knows what's happening there. But that's really cool. That's really cool possibility. I just think that the dogs, mothers, and lovers idea is that they're probably eating the same foods.
Yeah.
Like they just don't have the threshold yet. And so they don't have the straw that broke the camel's back. Boo. But then maybe kissing that, and maybe it was the day that the bugs were the most, because every 90-day cycle. And so maybe it was a bigger bolus inoculum. And then that person they were both tired and, the immune system's down, and then it can't deal with it. Maybe that's
possible
just gets put in it. But I know, I do think that it's spread. It's kind of like they say there's a strep person in the family. If there's strep all the time, I don't know if you believe that.
I don't either, because again, if I were to take a swab, I think last I checked, it's either 1/3 or 2/3
has strep already.
Of the population have strep in their lungs, right? Or sorry, in their throat right now, and they don't presently have a strep infection. So it's like, if that's the pathogenic entity, then why is it there but not causing any issues?
Yeah.
So
it's the threshold, I think, is a good way to say it, like in everything. And as you get older, you can't deal with certain things. You have a tighter threshold on cardiac output and lung output. And so maybe it's the same with your immune system modulating it. And, there are a lot more problems in the mouth, as you get older.
I'm excited for you to check out pleomorphism, because I wonder if it'll like, I don't know. It'll
morph my mind.
Yeah, it'll morph your mind.
Morph my microbiology. Yeah.
Okay, I don't think I have anything else. This has been awesome.
We covered a lot of stuff.
We did. We covered a lot. So,
one of the things we could do is, like, if people make comments, what would they want to hear? Like, I would love to come back. I mean, it would be easy for me to come back. Especially Confluence, if I come next year again. And,
cool.
But I love contributing, and I talk to Zach a lot about, you and what's going on here. It's really special, but you have to make it keep going, and you just have to figure out how to do that. I mean, I would love a card, cards that the way forward, because I tell people about it, and then, if it has a Q code on it, and,
I'll make sure we get some of those.
That would be cool. And then the cluster thing, I think, is a cool idea. And maybe facilitators, like I know that, Zach, that's how I know him. He's facilitating. But if there was like a person in my little zone, it could be me. I mean, this is the weirdest thing. There's a Confluence PA. Do you know that?
There's also a Confluence, Wisconsin.
I tried to look up Confluence. I only could find that. I didn't know that's cool.
It's called, the Wisconsin one's called Wisconfluence.
That's Wisconfluence? Well, this is actually Confluence PA.
That's so interesting.
It has river rafting, like it has the Yakagani, so you can go really crazy,
Yeah.
You can go middle of the road, or you can go really mellow rafting or kayaking. Then it has a towpath that's been converted, an old railroad bed that's converted. So we used to do 25 miles to one way and back with the kids, and it was so much fun.
That's cool. Well, we'll get you back on to answer even more dental related questions after people watch this. So Dr. Marc, you're the man. As a final question, if people are really wanting to find a biological dentist near them, hopefully we continue to add more on the Way Forward platform. That's going to be a slow grow process. But for now, isn't there another map that the organization you're a part of has?
There's a map on the International Academy of Oral Medicine Toxicology, and the IABDM also has, I believe they have a find with the zip code.
Cool.
So the thing that you have to do is look at you have to pre-qualify them based on this conversation we just had. They have to do safe removal, and they have to have they may not do surgery. That's not a problem. They may not be able to do those things. That's not a problem, but they could have oral surgeons that use the right tools, but a lot of oral surgeons don't use the right tools, just like regular traditional dentists. So I would say zip code wise, you can do that way, state wise, word of mouth. I mean, I don't want to get into a bunch of referrals. Like that's difficult for me to do with the integrity I have, with trying to send people to different places or something. But you can usually, like some states have a lot of dentists, that are holistic or claim to be, politically correct way to say it is they need to be trained and do the things that we talk about. Like if they're not walking the walk, like I've had cavitation surgery, I had my mercury out, like you have to walk the walk, talk the talk too. And so you kind of have to screen them. Like if the intake, good thing is calling the office. If the secretary absolutely knows nothing about biological dentistry, then that's not the place for you. Like if you call my office, Amy knows like what PRGF is, and she knows why we take out mercury safely. And so the education of the office is a good one. Their website should have safe protocols on there. If they don't go. If you're getting mercury out. If you're getting root canals out, you should have your mercury out first. And if you're going to go through cavitation surgery, you should not have any of the hardware in there. But word of mouth is really good, and watching people like me, talk and trying to see integrity is huge. But I think most of the doctors, like the problem is most of them don't take insurance. We still take a couple, but they tend to be expensive, and that's the hard part. And I'm on a Facebook, the Nico Facebook group was like 9,000 a few years ago. It's like, 30,000 now. And they really are upset with traditional dentistry. And I don't know what to say to people about that, because it's so hard to say they don't know what they don't know. And and I feel sad for like my profession, because I wanted to be a dentist so young, since I was 8 or so young, that I feel like it should be a real thing, not hurting people. It should be true, and trying to be like the Hippocratic Oath, really. Yeah. And iatrogenic dentistry, we cause problems because of the materials. Mostly, a lot of times, it's not that they're not skilled. Like people know what they're doing technically, but it's the materials. So, but anyway, getting them removed, rebaking your cake is not easy. So you have to have a long game plan. You have to definitely get your nutrition up, your detox pathways going. You really want to be able to poop every day. You want to maybe more than once a day, which is, really better. You have to eat the right foods, nutrition, and stop adding to the pile of junk that's in your body. And then be ready mentally. There are people that don't want to do anything because they're stuck. So mercury does create a problem with neurons. So I do think that that's one problem dentists have, is they don't really want to change, and they don't think they see a way to change or a pathway to change. So if you're ready to do the journey, I mean, I would love to help. And I could do Zoom calls. I do them all the time, consults where I can help people. But, a lot of times a revision takes 1 or 2 appointments, and usually people come to the town and they stay at the hotel and all that. But I never would have thought I would be doing this. Like people say people will fly in to see you. And I thought, no, that's probably not going to happen to me. And it's all those thoughts we put in our head, But as far as access to the Holistic Dental Society also has people. There's DAMS, which is Dental Amalgam Syndrome. It's a non-for-profit. DAMS, DAMS, has resources of other dentists. Weston Price sometimes has resources too.
Yeah.
But, converting your dentist might not be easy. But you could always say it, the more times we say it in the consciousness that we're in now, like this is what I believe.
Yeah.
I say peace and love in a lot of my texts. I think I did to you before I loved you. Like I just try to be saying the things that need to happen,
Yeah.
So like, it doesn't make sense to use metal. Most people know they're like flabbergasted. It's still being used. So, the introduction to the subject could be you. Telling your dentist that. So I don't know. It's a big position to be in that way. Like my dad gave his physician a statin book, hair,
That's what changes people sometimes, though. Yeah. Or listen to this conversation.
Yeah.
Yeah.
I don't know, to see me, like you probably put all that in there, but
yeah, we'll throw it on the show
MD
notes.
Dental Wellness Center and Marc DiNola. And I don't have, usually you look up holistic or biological dentists in your area near me, then you would see maybe someone pop up. They're pretty good. Most guys are using pretty good website stuff. The academy, you don't have to go through the academy. There are people that are in different camps, on stuff just like not in the academy that probably know about it. But you have to be careful. I think that's the main takeaway. The pearl is get rid of the shit food, right?
That's it. Yeah, that seems to be coming up a lot during this. That sounds about right, though. So,
yeah.
Okay. Dr. Marc, thank you so much for joining me. This is awesome.
That means edit, doesn't it?
That does mean edit, technically. Thank you so much.
Yeah. Thanks for inviting me. It was awesome
experience
for me.